Good morning, and welcome to our third annual Public Policy Summit. I am Melissa Silva, the Executive Director of Louisiana Mental Health Association, and we are so glad that you've taken part of your morning to join us. LAMHA is proud to serve as a leader in such events as today, as we continue to offer quality behavioral health services and programs, as well as education and advocacy. Most of today's presentations have been pre-recorded, but you will have the opportunity to hear from a few guests live. You will hear from state leaders and other guests that remain committed in their work within the behavioral health field, as well as hear from others that continuously advocate for much needed services and programs that serve those most in need in our local communities and state. Through our professions, with our families and friends, and even individually, we have all been exposed to the behavioral health crisis in our communities, our state, and nation. That is why, as advocates, it becomes very important to be part of discussions like today. The statistic 1 in 4 experiencing a behavioral health crisis still today causes me to pause. Recent national prevention and screening data reports that nearly 1/2 of the 15,000 individuals that screen each day are those individuals 24 years or younger, with most screening for anxiety, depression, and thoughts of suicide. In Louisiana, the screening data is very similar. From October to December 2022, screening data told the story of this same age group being the largest group of screeners, with all of the screening results of either depression, ADHD, or anxiety. We have all done a great job in the last year advocating for mental and behavioral health services and programs. Last year's advocacy efforts won big. In fiscal year 2023, Louisiana will receive over $12 million in mental health block grant funds. That is over $2 million more than the previous year. We must, however, continue our efforts on behalf of our youth, our peers in the workforce, and push for additional dollars in prevention. Early intervention can and will make a difference. Our 988 initiatives remain an important service within our state, and we will continue to advocate for additional dollars to grow that program. LAMHA remains steadfast in our advocacy and educational efforts within our state. Following today's Public Policy Summit, we will host our annual conference in April with topics that are relevant to the behavioral health field. On May 4th, join us at the Capitol for Behavioral Health Day. You will hear testimony from those in recovery, as well as have the opportunity to hear from our state legislators. Registration for both events are now open, and information on how to register should be shared later today. I want to thank you again for joining us today. You are making a difference. I would like to especially thank our presenters who have shared their expertise and their time. Please enjoy today's summit.
Good morning, everyone, and thank you so much again for joining our annual Public Policy Summit. Today, we are joined by Representative Schlegel, who is a mental health champion at the Louisiana State Capitol. Representative Schlegel last year helped introduce a bill that will save lives for our youth in our schools. Good morning, Representative Schlegel. How are you?
I'm good. Thank you so much for having me.
Thank you. And today, Representative Schlegel will share some remarks as to how she is a mental health advocate, as well as how to best get involved with public policy and how to be the best advocate when having meetings with her. Take it away. Thank you again for joining us.
No problem. Thank you for having me. So again, I'm Lori Schlegel. I am a licensed professional counselor, and I'm also a CSAT, a certified sex addiction therapist. I work at Lighthouse Counseling Center, and we specialize in helping those struggling with compulsive sexual behavior. I'm married to my high school sweetheart, and I have one son. So I'm also a state representative. I represent District 82, which incorporates Old Metairie, Old Jefferson, and Airline Park. I was elected during a special session, so I've been in the legislature for 2 years. And as state representative, we serve on standing committees, which for me includes health and welfare, which handles issues around mental health. So last session, I passed 2 bills dealing with mental health. The first, I was the lead author, and I partnered with the Sandy Hook Foundation. This was HB 495, or titled the Save Students Act, which stands for Suicide, Safety, and Violence Education. So it mandated, so what we found is teachers were being trained on this, but students were not. And so it mandated 1 hour of education training for students 6th through 12th grade on suicide prevention, and 1 hour of education training for violence, safety, and social isolation prevention. And it allowed for the creation of each school to have a student-led club on these mental health issues. I also co-sponsored with Rep. Duplessis, actually now Senator Duplessis, on HB 981. And this stated that schools had to integrate instruction on mental health from K through 12, appropriate to their grade level, and it would be integrated into their health education classes. So I am a mental health champion. Obviously, I'm a counselor, but I also know how important mental health is to the functioning of human beings. And right now we are in a mental health crisis coming off a pandemic, and also the studies that are coming out about children, especially the CDC's recent report on mental health of teenage girls. I'm super passionate about kids, as many of my bills revolve around helping kids. So I got interested in public service because I think working in the helping profession just lends itself to public service. I have always served, whether as a CASA advocate or working at a homeless shelter. That is what public service is. It's helping and serving others. And I believe it's a natural fit. I'm not in this for anything, not for money or power or prestige, but making a difference. And I think that's what all of us who care about mental health and who are advocates do on a daily basis. So how you can be successful advocating to legislatures. The first thing I think is that start with your local state representative and senator. So we are elected to represent a district. And if you call your elected official and say you live in the district, that is going to give you the best response and really help you get an ally with someone who is there to represent you. And so it always helps starting there. It always helps to really know your issues and to be able to educate us in a short period of time on your issues. Because look, we see a ton of issues from, on my committees, taxes, health, insurance, education. And so you being an expert in that and helping to educate us will best serve. So if you want to contact me, you can email my office at hse82@legis.la.gov or call at 504-655-6887. My legislative aide is JP. And thank you so much for having me. I hope to continue this work. I am looking to pass a study resolution to sort of study mental health and addiction as a whole. And hopefully we can kind of see where some of our weaknesses are and where our strengths, and sort of build on that to better help the people of Louisiana.
Thank you so much, Representative Schlegel, for being with us this morning. I know y'all have extremely busy schedules, so we're always so grateful for you. And thank you for being a champion for our youth as they are experiencing a mental health crisis today. And we have seen, those numbers. So we really appreciate the legislation you passed last year, and we appreciate your efforts to continue to be a mental health champion. Thank you so much again for joining us.
Thanks for having me. Bye-bye.
We are now joined by Representative Davis, who is another mental health champion at the Louisiana State Capitol. Representative Davis will also share her remarks as to how she is a mental health champion at the Louisiana State Capitol, as well as ways that y'all can be best involved with advocacy efforts with her. Thank you so much for joining us this morning, Representative.
Good morning. Thank you for having me. I really appreciate it for y'all asking me to give a little presentation to you guys this morning. I don't know how I follow Representative Schlegel. She is a mentor to me, especially in this area because of her field of work. Her knowledge is endless, and she is absolutely I could probably safely say all of my colleagues go to regarding mental health awareness, mental health education, and mental health advocacy. So I am just so grateful to her and to have her in the legislature with me as my mentor on this issue. Mental health for me is something that I have dealt with for probably 22 years in my life. It's no secret I suffer from pretty severe anxiety. After I had my child, after I had Hayden, I had terrible postpartum depression, and as a result, anxiety till to this day. Luckily, I had the family support, which is always so important in these situations, to help me cope and deal and learn about what was going on with my body, and understanding that this was something that was not something that I could absolutely control without medication or without therapy or access to healthcare. So I completely have a soft spot in my heart for those, especially going through the postpartum depression times. Also, my daughter suffers from pretty severe anxiety as well. So unfortunately, she got that from me. But fortunately, she has parents who are very aware and are very willing to help her get educated and get the help that she needs. And she does. And she continues to do that on a daily basis with her therapist, and also finding ways to cope with her anxiety, especially because she's at Medical University of South Carolina. So she's in a really high stress situation at school. So she has learned ways to deal with and cope with her anxiety. Of course, I think that there are many other, probably more, what we could argue, more severe mental illnesses out there. And I think that every one of us has family members or friends or acquaintances that we know that suffer from these debilitating conditions. And for me, it's the awareness part is key. And I'm very happy that in this day and age, we're beginning to talk about it, and we're beginning to recognize that it is okay to talk about mental illness. It is a necessity, especially for our young kids. I don't know how I would cope with having a teenager at this stage in life with all of the social media pressures. I see it every day with my daughter, although she's older, so she's a little bit past all of that. But still, it's a very difficult thing to navigate, I think, right now for kids, especially. One of my daughter's best friends committed suicide at the age of 15. It was a very devastating time for us. So I am, again, with Representative Schlegel, a huge advocate of early access to care, education, much like we do for early childhood education. And we put such an emphasis on that. We have to put an emphasis on early mental health education, awareness, and treatment. So I'm very, very proud to be a huge advocate for the Mental Health Association. Anything that I can do for you guys, I am always willing to do. Always willing to listen. My door is always open. My phone is always available for you to text me or call me. I got involved in politics probably about 30 years ago. I started out working as a page, went to college, and was a political science graduate, and ended up as a lobbyist. So I lobbied for about 16 years. And within that time frame, I also was Deputy Commissioner of Insurance. So I understand the importance of access to insurance coverage for mental health. And I'm glad that back in the 90s, now Commissioner Donlin passed a mental health parity bill. So that was very wonderful for the state of Louisiana. I don't know if every state has mental health parity, but Louisiana does. So in my role as a state legislator, I've been in the legislature for now almost 8 years, which is so crazy to think that it's been that long. Again, I am always looking to be a champion for this cause, anything that we can do for our children to help them become active and participating citizens of our state and our country. I'm always willing to do that. How can you get involved? Call us. I think Representative Schlegel said it best. Our doors are always open. We look to you guys to educate us on issues that affect your association and your field of work. We see thousands of bills every year, bills, resolutions. There's no way for us to be experts in every single situation. So we really do rely on you guys as mental health advocates to come to the Capitol or to come to our office or just call us or email us and educate us on the issues that are at the forefront of your industry. Don't be shy. We are regular people. A lot of people, when we call them back and say, oh my gosh, Representative Davis is calling back, I'm like, call me Paula. I'm just like everyone else. I love what I do. I love being an advocate for my constituents, and I love being an advocate for my family, because a lot of this for me is looking toward the future for my child and hoping that one day she'll come back to Louisiana, because it is a great place to live and to work, and to raise a family. So we really look to you guys to educate us on all these issues. My door again is always open. You can contact me at davisp@legis.la.gov. My legislative assistant is Bonnie Cobb. She is amazing. She is a CPA by education and trade, so she is very organized. And I will always get your phone calls and we'll return those back. And our number at the office is 225-362-5301. Again, call, text us anytime, email us, and we look forward to seeing you guys at the Capitol. And any way we can help, never hesitate to reach out.
Thank you so much, Representative Davis, for speaking.
Thank you.
And being vulnerable about your mental health and how you said the necessity to be able to speak about it is just becoming more prevalent in today's time. So
well, and thank you. And I'll add that, when I first had Hayden, I didn't talk about it because I was embarrassed. I come from a really strong Cajun family. We show our feelings, but mental health was never discussed. It's like, oh, get over it. And it's no, you can't just get over it. It's not something you can just get over. It is not a bug bite. This is a disease, and it's something that we have to acknowledge. And so it was a year and a half until I finally realized what was going on within myself. And luckily I had a husband who was very supportive in bringing me along this journey to better health and helping me understand and cope with my anxiety. So it wasn't easy. But and my friends laugh at me because every time they had a baby, I'd say, oh, great, the baby's cute, but how are you? Checking in on my friends, because I can't be a good mom unless I'm healthy. I can't be a good wife unless I'm healthy. And I recognize that and understand it. So I'm constantly talking about it with new moms. Don't be afraid to share what you're going through. Same with my daughter and her friends, whether they're going through body dysmorphia or depression or so many things on these kids today. I think it's just so important for them to talk about it.
Right, exactly. And having leaders like you discussing it is exactly what we need in this state. So we are just so grateful for you and Representative Schlegel for joining us today and sharing your passion and being a mental health champion with us at the Louisiana State Capitol. Thank you.
Anything we can do, you call us.
We will certainly do that. And our advocates today will learn exactly how to get that message across with y'all. So
awesome.
Thank you so much.
And if you ever need advice on how to do it, call us. We are here. I was a lobbyist. We're here to help.
That's awesome. We appreciate you so much. You take care and have a great day.
Thank you. Thank you, guys.
Bye, Representative Davis. All right. Before we continue with Miss Karen Stubbs Church, I'm going to do a brief drawing for our state conference. An attendee from our previous behavioral health 911s held in the fall will be able to get the chance to win one free ticket to our state conference happening in April. And that winner is Miss Elena Matten. So if you're joining us today, we will email you later on with how to receive this ticket. Again, thank y'all for joining us. We will now move on to our pre-recorded segment with Miss Karen Stubbs Church.
Good morning, Louisiana Mental Health Association. I am so excited to be a part of this public.
Hi, everyone, and thank you so much again for
Good morning, Louisiana Mental Health Association. I am so excited to be a part of this public policy summit.
We ask your patience as we try to work out this technical difficulty. We'll be right back.
All right, while we sort out those technical difficulties, I do want to quickly go over some of our mental health wins that we did at the federal level with Mental Health America. One of these wins was a $150 million increase in the mental health block grant, which brought it to over $1 billion for the first time in its history. There was also a set aside for crisis services in the mental health grant, as well as over $500 million for the 988 Lifeline and a new crisis coordinating center at the Substance Abuse and Mental Health Service Administration, also known as SAMHSA. There was also new Medicare coverage of certified peer support specialists in integrated behavioral health settings and as part of our mobile crisis interventions. There was also over $1 billion in funding for school-based mental health professionals and a pipeline to increase workforce diversity. And I think as Representative Schlegel and Representative Davis said, we are in need of services, especially at our schools. We've also seen that there has been new Medicare coverage of marriage and family therapists, licensed counselors, and expansion of psychiatric training residencies, as well as authority and funding for peer support services with veterans, birthing individuals, and individuals at risk of our justice involvement. And our final win at the federal level was an elimination of the redundant X waiver requirement to prescribe buprenorphine for substance use disorders. So those are some of our wins at the federal level. And this year, we will also be having some asks with Mental Health America at the federal level. One of them being is to set aside money for prevention in the mental health block grant. So right now, we don't have any money set aside for prevention interventions, which we know can be life-saving if we detect mental health conditions at an earlier stage rather than wait for them to get more severe. So we're asking Congress to have a 5% allowable use for states to use mental health block grant funding for prevention activities and early intervention activities that research has shown can mitigate or even prevent incidences of mental health conditions. We know that block grant funding is used for those who are uninsured, who cannot afford services, or whose services are not covered by their health plans, such as crisis management, intensive in-home services, early psychosis, and support education and employment. So this set aside would be huge in helping catch these mental health conditions at an earlier stage, but also prevent them from even occurring. We are also asking for Congress to build on top of the achievement to expand peer support specialists with Medicare. We want peer support specialists to be able to help across all Medicare settings beyond just integrated care and mobile crisis units. And we also want these peer support specialists to be billable in any setting with Medicare. So that's one of our second asks that we have at the federal level. And then our final ask is, again, as Representative Schlegel and Representative Davis really emphasize, is the need for helping our youth who are undergoing a mental health crisis. We know that right now data is showing a decline in well-being in both children and adolescents. We've seen an increase in isolation and suicidality, as well as greater rates of depression and anxiety. And this can especially be seen in demographics like our teenage girls, our LGBTQ youth, and our BIPOC youth. MHA National has actually worked with the CDC on coordination of their adult mental health efforts, which include data gathering and sharing, school prevention funding for mental health, and suicide prevention funding to develop strategy and implementation to drive a more preventative approach to youth mental health. In 2022, MHA and partner organizations were actually able to secure appropriations and report language requiring a greater effort of adolescent mental health at the CDC. So in fiscal year 2024, MHA is asking for Congress to provide $5 million in funding for a new behavioral health coordination unit at the CDC National Center for injury prevention to coordinate adolescent mental health activities and culturally responsive preventions. And now we will take it back to our recorded session.
Good morning, Louisiana Mental Health Association. I am so excited to be a part of this public policy summit. As you all know, the COVID-19 pandemic has magnified the challenges facing adolescents and children's mental health, causing altered experiences at home, at school, and in social interactions. The pandemic also highlighted the need for increased access to healthcare and social services, as an alarming number of young people struggle with feelings of helplessness, depression, and thoughts of suicide. In response, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association have declared a national state of emergency in child and adolescent mental health. The Louisiana Department of Health and Direct Response is introducing several new initiatives focused on the behavioral health of children and adolescents and their families. This group of initiatives, called Services from the Start, providing behavioral health support for Louisiana families, focuses on improved access to early childhood, adolescent, and family behavioral health services. First, expanding upon the Medicaid Adult Crisis Services Continuum introduced in the Department of Health's fiscal year 22 business plan. OBH is committed to extension of mobile crisis response and community brief crisis support services to youth. MCR, Mobile Crisis Response, is an initial intervention for individuals in a self-identified crisis, in which teams deploy to where the individual is located in the community. CBCS, Community Brief Crisis Support, is a face-to-face, ongoing crisis intervention response designed to provide stabilization and report. LDH was committed initially to development of a crisis response system for the population of adults identified in a Department of Justice agreement. But OBH's vision has always been broader. We want to help be on the other end of the phone line for all Louisiana citizens. We are seeking now to secure funding to begin the expansion of crisis services to youth in this legislative session's budget, with request being to begin in the fourth quarter of state fiscal year 2023 to 2024. Planned expansion includes both mobile crisis response and community brief crisis support. LSU Center for Health Evidence to Practice and OBH are laying the groundwork now for this planned expansion. And what is different about crisis services for kids versus adults? I mean, we've all heard that kids are people too. Many of the values and principles that OBH and LSU Health Science Center have embedded in the crisis system for adults apply to children as well. The fact that voluntary is better and reduction of iatrogenic harm. Lived experience lends credibility to helpers. The goal to divert from institutional levels of care when appropriate and support youth to remain in homes and communities. And the goal to respond to crisis in ways that increase youth and family sense of safety and trust. But kids are not just tiny adults. Developing effective services for youth requires that we understand the ways in which children's experiences of crisis are different and require differences in response. The caller seeking mobile crisis response for youth is less likely to be the youth experiencing a crisis and more likely to be a parent, guardian, or a school. This means that to build an effective crisis response system for kids, we need to build trust with parents and schools. It also means that the crisis response team is also never responding to just one person. In almost all cases, the crisis will involve both a youth and an adult. The response team needs to work with the youth and the caller or adult to effectively resolve the crisis. Just as with adult services, having a team member with lived experience can lend credibility to helpers. In the case of a youth crisis mobile team, which is responding to both the youth and the parent in a crisis situation, there's a huge advantage to having a family peer on the team. A family peer with lived experience parenting a child with behavioral health needs and system involvement can bring invaluable skills at engagement and credibility to a crisis response that includes a parent. A youth's crisis is less likely to be resolved over the phone. When the school or the parent calls, the youth might not want to come to the phone, and kids may not be great reporters over the phone about their status. So best practice in youth mobile response is to just go. Mobile teams should be just that, mobile, and should respond to the vast majority of calls with a mobile response rather than a telephonic intervention. OBH's budget for the 2023 legislative session includes the addition of youth mobile crisis response and CBCS as Medicaid covered services, anticipating to launch in the spring of 2024. We expect regional applications this fall and have allocated additional startup funding to assist these providers. Secondly, OBH believes in the expansion and enhancement of temporary assistance for needy families funded substance use residential treatment facilities for women with dependent children. Pregnant women and women with dependent children are among the most vulnerable of all populations in need of stable residential services for substance use disorder treatment. Residential treatment programs provide services to women and their young children who can accompany their mother while in treatment. This arrangement preserves the family unit and addresses historical barriers such as childcare and transportation to accessing SUD treatment services for women. OBH is in the beginning of the process to identify additional providers to fill geographic gaps in services to establish additional treatment beds for mother-child residential treatment facilities in Louisiana to accompany the 3 providers we already have. Thirdly, early childhood, meaning the 0 to 5 population. Early childhood supports and services provides screening, evaluation, and referral services and treatment for children from birth through age 5 and their families through evidence-based behavioral health treatment. This includes support for enhancing positive caregiving relationships and comprehensive care coordination, addressing family needs, including the family's environmental risk and the social determinants of health. OBH intends to pilot an ECSS early adoption site while pursuing a contractor for long-term management and administration of a statewide program. Also, treating trauma must be addressed, and treating trauma through the implementation of dialectical behavioral therapy, DBT. Apologies for the mispronunciation. It's a complicated name for an intense service that is so needed. DBT is an evidence-based, comprehensive intervention designed to treat adults and adolescents with severe mental disorders and specific cognitive, emotional, and behavioral patterns. These patterns often result from early or chronic experiences of trauma, neglect, and abandonment. OBH will partner with the LSU Center for Evidence to Practice to support specialty DBT training for providers with a phased rollout of delivery of therapeutic services to Medicaid adolescents and adults. And last, psychiatric residential treatment facility for those with co-occurring behavioral health and developmental disabilities. A study group convened by OBH and the Office for Citizens with Developmental Disabilities, one of our partner agencies within the Department of Health, solidified the need in Louisiana for a PRTF program with the expertise and capability to effectively serve youth with intellectual and developmental disabilities and co-occurring behavioral health conditions. PRTFs are non-hospital facilities offering intensive inpatient services to youth or adolescents who have various behavioral health issues. They are required to ensure that all medical, psychological, social, behavioral, educational, and developmental aspects of the member's situation are assessed and treated. OBH is currently developing this program with OCDD for a highly specialized PRTF with up to 25 beds, specifically focused on treating the co-occurring mental health and developmental disability youth. In all, recognizing the needs to address the behavioral health, youth and adolescent crisis, OBH is building upon the currently available services for Medicaid eligible children, adolescents, and their families through these new or expanded services that are all under development and you'll see rolling out through fiscal year 2024. We are happy to be part of the solution and work with our partners towards developing and implementing this multi-pronged approach in specifically addressing youth, adolescents, and their
Hi, everyone, and thank you so much again for joining our Public Policy Summit today. My name is Tatiana Gonzalez Quiroga, and I'm the Advocacy and Education Manager here at the Louisiana Mental Health Association. Today, my presentation will focus on Advocacy 101. I hope that you use these skills learned in my presentation to gain more confidence in being a better advocate for mental health. I'm going to stop sharing my picture on the screen so that you can take a better look at the slides that I'm going to share. I hope that you enjoy and you get something out of my presentation. Before we dive into content, I want to give you a brief background as to who we are at LAMHA. Our mission is to provide services, education, and advocacy for people who need mental and behavioral health support. LAMHA has been serving the Louisiana community since 1954. Here at LAMHA, our work derives from these core values. These core values also guide us in choosing our stance on policy issues. These values are protecting the dignity and respect of those who we serve, providing quality services that enhance the lives of the people that we serve, empowering the people we serve to be active participants in their care. We're constantly working to fight stigma and prejudice towards individuals with mental illness. And we are also working to promote social justice for mental and behavioral health conditions. LAMHA offers several services to the mental health community in Louisiana. The Lines Drop-In Center is located in Baton Rouge and serves over 200 clients annually with various mental health conditions. This is a peer-run day program and supports our clients and advances their wellness by providing stability, education, stimulation, and socialization. We also have the Fisher Project, which offers comprehensive suicide follow-up and recovery support services. It is a 6-month case management program led by case managers with lived experience under the supervision of a clinician. Target Health is a statewide whole health program that is designed to offer practical solutions to people living with behavioral health issues. This is a 10-week program that will train peers to lead peers in small group settings. It targets different aspects of health like exercise, nutrition, relationships, and spirituality. It is now offered to both adults and youth. We also have our Recovery Center, which is in Morgan City, located in Region 3. This is very similar to our drop-in center in Baton Rouge. Of course, we're excited to share that this year's behavioral health will take place on May 4th. Behavioral health will gather over 200 advocates at the Capitol to meet with legislators and rally for behavioral health. Today's public policy summit is in anticipation of behavioral health. Today, you're going to hear from advocates on why your advocacy is needed at the Capitol and elsewhere. We will show you how to register for Behavioral Health Day at the end of this presentation so that, again, you can use the skills learned at the Public Policy Summit today to make a difference. All of LAMHA's events are free and they are open to the public. To learn more about them, you can go to www.louisianamha.org. Now let's actually dive into advocacy content. So you may be asking, what exactly is advocacy? In its simplest definition, advocacy is the act or process of supporting a cause or a proposal. It stems from the Latin word advocare, which means to call out or support, to call out for support. A lot of people have the misconception that you have to have a law degree or be involved in politics to be an advocate. However, today that you're going to learn that anyone can be an advocate, including you. Unfortunately, there are barriers that impede on adequate mental health and on mental health advocacy. The first is stigma. We all know how stigma can prevent people from talking about mental health. But we know that the more we talk about it, the more people can realize the need to support our mental health services. There's also a misconception that mental health is considered a them issue, meaning if I'm not directly affected, it shouldn't be my problem to advocate for those who have mental health conditions. However, I think at some point in our lives, whether we are affected personally or someone we know is affected, we will all eventually become mental health advocates, and we should. Unfortunately, we know that when someone has a mental health emergency, they are either sent to the emergency department or they are met with police response. Statistics show that 1 in 4 people with a serious mental illness have been arrested by the police at some point in their lifetime, leading to over 2 million jail bookings of people with serious mental illness each year. This shows that there is a criminal justice problem associated with mental health, and it truly poses a barrier to care. Another barrier is that mental health is still not seen as mainstream healthcare. Now, I want to share some data conducted by screenings by Mental Health America. According to the screenings conducted by Mental Health America, the top 3 diagnoses that appeared in Louisiana were depression, ADHD, and bipolar disorder. 55.85% of the screeners who took the online screening in Louisiana mentioned that they have never received any care or treatment for their mental health condition. Again, perhaps this could be because of some of the barriers I listed above. It also showed that students were the highest participants who took the online screening. Perhaps this shows that our students today are truly struggling with the mental health, and we need to be better advocates for them as well. Mental Health America's national founder, Clifford Beers, is the perfect example of a phenomenal advocate who truly paved the way for mental health equity in the United States. After being subject to horrible abuse in both private and public health institutions, Beers knew it was time to stand up. He knew that he had to use his past experiences and stories to reveal the broken system. His famous quote, "I must fight in the open," shows us that staying silent about problems we are facing will not ever help to make a change. Politics cannot be treated as a spectator sport. You must play in it and be directly involved. This is how government truly works. We must advocate out loud and share our experiences to make a difference in mental health in Louisiana. Mental Health America's Before Stage 4 campaign is also a main driver in helping us choose what to advocate for. Our world likes to raise awareness for diseases that are common, like cancer, diabetes, heart disease. And we're always trying to advocate for prevention before these diseases become more advanced. But do we do the same for mental health? The answer is we don't. The Before Stage 4 campaign is aimed to educate our communities about prevention for all at risk of developing a mental health condition. It advocates for integrated services and supports for those who need them. This will ensure that people get connected to the right care at the right time and prevent people from
having to struggle with their behavioral health condition until the point where it becomes very serious. We want our officials to know that there are ways to prevent a mental health crisis from happening, but we must put the systems in place to do so. Now, I want to dive deeper to show why behavioral health advocacy is so needed in the state of Louisiana. According to NAMI, there are 715,000 adults in Louisiana who have a mental health condition. To put that into perspective, that is 3 times the population of Baton Rouge. We also know that of 194,000 adults in Louisiana who did not receive mental health care, 41.8% of the adults did not receive care because of how expensive it was. Louisianans are also 4 times more likely to be forced out of network for mental health care than for primary care. This makes it a lot more difficult to find care and afford it because of higher out-of-pocket costs. I mentioned earlier that students were the highest screeners who took the screening in Louisiana. We know that 44,000 Louisianians aged 12 to 17 have depression. This next statistic is truly astounding. 3,398,990 people in Louisiana live in a community that does not have enough mental health professionals. In Louisiana, 720 lives were lost to suicide, and 159,000 adults had thoughts of suicide in the last year. I think these statistics I just shared with you, although somber, really do demonstrate that we need better behavioral health services in Louisiana. Now let's see where advocacy takes place. Advocacy takes place anywhere, but let's break it down. You can be an advocate at the government level. If there is a certain bill that affects you, you have the power to call your legislature and demand change. You can also call your leaders and inform them of key issues affecting your community. Remember, you elect your leaders to represent you. They want to hear from constituents about what matters to you. Advocacy can also be done at the personal level. We can be better advocates for ourselves at our doctor's offices, at our schools, at our jobs, etc. As you can see, you can be an advocate anywhere. To be an advocate, we have to break it down to the basics and see how government structure works. You've probably taken this course in high school before, but I just want to refresh you on a little more tips. Now, we know there are 3 branches of government: the executive branch, the legislative branch, and the judicial. At the federal level, the branches consist of the president, Congress, and Supreme Court. At the state level, we have our governor, the legislature, and the state Supreme Court. We also have local government, like our mayor and our city council. The executive branch at the federal level consists of the president. The president is in charge of carrying out the law. At a state level, we have our governor. When it comes to the legislative session, the governor can sign a bill into law or veto it. We elect our president and our governor. If there's a bill we want our governor to support, we can email or call his staff in support. Our current governor is Governor John Bell Edwards. At the federal level, the legislative branch consists of our U.S. senators and our congressmen. Every state has 2 senators, no matter the state's population. Therefore, there's 100 senators in the United States. The amount of congressmen a state has will vary on that state's population. There are 435 members of Congress in the United States. Louisiana has 6 congressmen. Louisiana senators are Senator Cassidy and Senator Kennedy. We are excited to share that you're going to get to hear from Senator Cassidy, one of Louisiana's mental health champions on the Hill today. The state level has senators and representatives. The legislative branch includes the legislature, which is comprised of the House of Representatives with a limit of 105 members and the Senate with 39 members. The distribution of representation in both houses is based on population. The job of the legislative branch is to pass laws. We elect our representatives, and their job is to serve their community. They want to hear from us, and they should hear from us. Within the legislature, there are committees, which are where bills are first heard. Committees are so important to understand as an advocate because they are where you can go in and share your story to representatives. It's also where you can first start sending out emails and letters educating your representatives about particular legislation that you are either in support of or opposed to. The committees that mental health bills usually pass through are health and welfare, insurance, education, and criminal justice. When the session starts, we're going to be sending out advocacy alerts to inform you of which bills we are tracking and what committees they are in. The type of session the Louisiana legislature has is based on what year it is. This year, 2023, is an odd number. Therefore, the session will mainly revolve around the budget. Each legislator can still submit a limited amount of bills that are unrelated to the budget. It is important that this year we advocate for mental health services to be fully funded. On even number years, the legislators are limited to non-fiscal matters only. This graphic is truly great because it shows how a bill becomes a law. As you can see, it's very complex, so I'm not going to go into a lot of detail, but I'm going to highlight some of the main points. The first step is the first reading in the House. After that, it is sent to the committee and heard. From there, it can either pass that committee or fail. If it passes, the bill is sent to the Senate's committee. From there, it is heard and voted on. If it passes the Senate's committee, it is voted on the Senate floor. Once it passes there, it is sent to the House. If there are no amendments added in either chamber, it is sent to the governor to sign. Once he signs it into law, he can sign it, and then it is turned into an act. If bills fail in the committee or on the House or Senate floor, they will not go any farther. Now let's look at our Supreme Court justices. At the federal level, our judicial branch consists of the Supreme Court justices. There are currently 9 justices. The president will nominate the justices and the Senate confirms them. At the state level, the governor appoints the justices. Louisiana has 7 justices. The Supreme Court's job is to interpret the law. Now, there are several ways that you can contact your officials. You can set up an in-person meeting, contact them via email, social media, their website, do it the old school way and send them direct mail, or just pick up the phone and call their office. During Behavioral Health Day, you will get the chance to meet in person with your officials. I want to show you how to find your officials in the next slide. This is what the state legislature website looks like. Let's take a look more into it. Oops. Now, as you can see, this is what the website looks like. We're going to go to your left and click Who are my legislators? On here, you will type your information. I will type our address to give you an example. As you can see here, it lists my representatives as well as my leaders working at the Hill in DC. From there, you can click on their specific site and find more information like their contact information, their background, the committees that they are assigned, as well as legislation that they have passed. You will get a chance today to also hear from Representative Davis. This is how you can schedule a meeting with Senator Cassidy in DC. You're going to go to his website and you're going to find the schedule appointment tab. From there, you can submit all your details to make a meeting request. Now that we have learned some background as to why we have to advocate for mental health, let's look at how we can do so to make a difference. Before we go into any meetings with them, make phone calls, or send emails to our officials, we have to do a little bit of research and dive deeper to find out who they are. This will help you find things that you have in common with them. Perhaps they go to your church, have family members with lived experience, or you have seen them at your favorite restaurant. These make great conversation starters. The most effective advocacy truly begins by connecting with someone on a personal level. After that, you can start speaking with them about the issue area that you're coming that day for. You may think that it can be hard to find information on your officials. However, you can do some digging on their official social media page or read their bios on their legislative website. Now let's dive into how to share our stories with legislators. You may think that you need an overwhelming number of statistics and data to be heard, but the truth is stories are even more powerful than numbers. Yes, we can include data in our stories, but politicians like to put a face to those numbers. Your story can give them a real-life example to a problem that affects their communities. There are three main ingredients to sharing your story. The first is being concise, the second is making an ask, and the third is following up. Being concise is an extremely important aspect of sharing your story. Officials' calendars are very busy, and they won't have a lot of time to meet with you. Being able to share your story in 1 to 3 minutes will give them a clear understanding of exactly what you are asking for. You want your story to resemble an elevator speech or even a movie trailer. Only cover the most important parts of your story that are going to directly correlate with your ask. Your story should be around 1 to 2 paragraphs long. When sharing your story, it is also important to be specific. Don't go into your meeting or a committee hearing with 100 asks. Remember to be concise and share your story and the specific issue you are focused on in 1 to 3 minutes. I suggest keeping it at a 2-minute maximum. You also don't want to share any parts of your story that may re-traumatize you or make you very emotional. Only share what you are ready to share. Now, perhaps the most important part of your story is your ask. Always ask your officials to make tangible change, whether it is supporting or opposing a specific bill, writing new legislation, or making your officials aware of an existing problem. Always ask. Some examples of asking are, can I count on you to support legislation XYZ? I am asking you to oppose this legislation. These are examples of ways that you can ask. According to Mental Health America, an ask is a requested action that may be taken by an elected official to change or reinforce a law. These actions must be concrete and they have to be measurable. After you're done sharing your story, always thank your official for their time. Even if they did not commit to your ask, remember to always be kind because you may never know when you have to meet with them next for a different issue. Even if they do not commit, always follow up with a 1-pager of more information. That way, they can still be more informed about the subject matter in a later time. This is one of my favorite quotes by Ruth Bader Ginsburg. She says to fight for the things that you care about, but do it in a way that will lead others to join you. Always set an example for others in how advocacy should be. Never be negative or unhopeful, even if things don't go your way. Always say thank you and keep moving on. To be an effective leader, you also have to have some qualities. The first is courage. It can be terrifying to advocate and to be vulnerable and share your story. However, take these actions despite those fears that you're feeling. It's okay to let your representatives know that you're feeling a little bit nervous. Remember that they are human as well, and they've probably been nervous before too. But remember to always share your stories and be courageous despite those fears. As Clifford said, we must fight in the open. We must also be persistent. It is important to hold our elected officials accountable. Let them know that you understand that they may not be able to act on this request right away, but that you are going to keep following up. Don't hesitate to follow up until you get an answer, whether it's yes or no. And finally, passion. As advocates for mental health, we must inspire others to join us through our storytelling. Energy is extremely contagious. Make hope always a part of your passion. Even when you are having unhopeful days or when that meeting may not have gone the way that you wanted it to go, always carry on and persist. As I mentioned earlier, we are so excited for our Behavioral Health Day on May 4th. Together, we're going to shine a light on behavioral health at the Louisiana State Capitol. I want to show you how to register for this event. It will be at the Louisiana State Capitol, and we will first rally at the Capitol steps before we do our meetings with our legislators and go to the park to enjoy lunch and meet with some of our vendors who are being behavioral health leaders in the state of Louisiana. This is the website. Behavioral Health Day is in partnership with the American Foundation for Suicide Prevention in Louisiana. As you can see here, you will see the itinerary, but most importantly, you will see where to register. It is very important to register for the event if you are planning to meet with your legislators. AFSP will schedule those meetings with your legislators, so please don't forget to register. I also want to share another one of my favorite quotes by Brene Brown. I think this truly encompasses what it means to be an advocate. Vulnerability is not about winning or losing. It's having the courage to show up, even when you can't control the outcome. I think this quote perfectly, again, sums up what it means to be an advocate. It means to share your story, to make a difference, and be courageous, even if you don't know what's coming up next. Remember that you were vulnerable and you stood up to make a difference. Please connect with us by following us on Louisiana Mental Health Association's Facebook to get the latest on our events, or going to our website at www.louisianamha.org. I also want to share this mental health screening, and I'll give you a couple of seconds to maybe scan the QR code. This screening is important to take if maybe you're showing signs that your mental health might not be the way where you want it to be, or you notice a loved one's mental health might not be how you want, might be showing signs that something is wrong. Take this screening and get connected to care today. Again, I'm going to leave it up for a couple of seconds. On behalf of LAMHA, I truly want to thank you for listening to my presentation today. I hope that you enjoy the rest of our public policy summit. You will be getting to hear from some phenomenal advocates and from our state leaders. Thank you so much again, and everyone take care and have a good rest of your day. Goodbye.
Hello, my name is Katie Corkin, and I am the Executive Director of the Louisiana Rural Mental Health Alliance. And I am here today to present to you a presentation on how to build relationships at the Louisiana State Capitol. But first, a little about me, how I became an advocate at the State Capitol. As you'll see here, my precious little family and Governor Edwards, that was in 2016. We were there all because of the little guy in the wheelchair. My son, Connor, he was born with multiple disabilities, numerous diagnoses, and relentless seizures. So in 2013, he began having about 150 seizures a day. And we had tried everything, diets, surgeries, medications, all of it. And his doctor at the time kind of laughingly said, well, I think the only thing left to try is medical marijuana, but it's not legal here. And the thought crossed my mind, like, well, why not? Let's try and get that done. I had never done legislation or advocacy at the Capitol at that point, besides even really knowing who my legislators were. So I was like, well, how do we get that done? And she's kind of scoffed and she's like, well, you can advocate for it. And so knowing me, I was like, okay, well, let's do that. Well, shortly after, I began going to the State Capitol and the legislature, meeting legislators, is joined by a slew of other medical marijuana advocates. And together, we finally got a bill in 2016 that would really make it accessible to those in Louisiana who needed this medicine. And so Connor joined me in committees almost every day during that session. We gave testimony, we were on the House floor when it passed, and then we were honored to join Governor Edwards when he signed the bill into law. And that session really taught me the importance of building relationships with not only legislators, but also the legislative assistants, the staff committees, the sergeant at arms, anybody and everybody at the Capitol. They get to know your face, your cause, and they somewhat join you in that cause. And so they become little champions all across the Capitol because they know you and they know that you're authentic in what you're advocating for. So relationships are crucial. Oh, okay. So this sentence really sums up a lot of why relationships are important. Long-term effective advocacy is built on positive, trusting, strategic relationships with legislators and policymakers and their staff. I say positive because a lot of times legislators, they hear so much negative. So they want to hear the positive, but they also really need to trust you. If they don't trust you and they don't trust your advice or the info that you're giving them, then it's going to be really hard to be effective in your advocacy. Strong personal relationships are the best means of influencing legislative decision-making. I cannot tell you how true that sentence is. If you've ever worked with a legislator or a policymaker, you know that this is because once they have that authentic relationship with you, they'll do whatever they need because your cause is somewhat their cause, and they want to see you succeed as well as fix the issue that you're bringing to them. Building relationships takes time and careful effort, but it is the most effective way to shape the thinking of those who decide public policy. So how do you go about building such relationships? In much the same way you cultivate regular friendships. So you're friendly, you're helpful to them, but your friend is also helpful to you. And there's a trustworthy source of information. You know, you're not going to befriend someone who lies to you often, right? So with legislators, I always tell people, you know, they're humans too, even though it's hard for us to see them that way sometimes. So we have to treat them just like we would a regular friendship. So as Louisiana's regular session comes up on April 10th, here are 5 tips on building an effective relationship with legislators and policymakers at the Capitol. Number 1, do your homework. First, find your district legislator. You can find that online, or you can reach out to people to help you, but then also make a list of other pertinent legislators. And so those legislators would be, since we advocate for mental and behavioral health, those would be the members on the Health and Welfare Committee in the House and in the Senate, as well as the money committees, because we need funding. So that would be finance, that would be appropriations. You want to really cultivate relationships with these legislators specifically. Research their personal history, their pet issues, any other issues that are important to them, because you want to have some background knowledge before meeting with them. Do they have any connection with mental or behavioral health? Sometimes we have, like Representative Schlegel, you know, her job is in this, she's a counselor, but then sometimes they might have a family member, or maybe they work in insurance. But sometimes if they don't have a connection to mental or behavioral health, maybe they were a teacher and they know firsthand the issues that our students are facing, or possibly they work for an insurance company. So you can connect your cause with their personal history in some way. Advocacy knows no political party. I am a big believer in this. You don't have to be the same political party as a legislator to be able to work with them, to befriend them. So once you get that like mindset of political parties have nothing to do with advocacy, because advocacy is about the cause. Having a basic understanding of the legislative process is very important too. And you know what? I feel like I didn't fully get that in school, probably you as well. But once you start advocating at the Capitol and you see the process, it's for us visual learners, it will get much easier. All right. Number 2, make contact. So call the legislator's office and introduce yourself. Schedule a personal visit to their office or through Zoom, because they really need to see your face. They need to hear your voice. They need to see you as a person, not just a name on their screen. Befriend the legislative assistants. I've gotten so far in my advocacy because I cultivated a relationship first with their legislative assistants, because as it says, they're a critical gatekeeper to that legislator. Once you're there in the office, small talk helps find commonalities. So you already did your homework, so you know an idea of where they're coming from, but small talk helps find like things you have in common. You might see a picture of their family and they have daughters. You might see that they like golfing. So just bringing up little things like that helps build a rapport. So then tell your story. Stories are so important in advocacy. You want to be concise and considerate of their time though. If you're like me, we can talk for hours about our cause because it's important to us. But the legislator, they've got a lot of stuff to do. They have a lot of stories to hear. And then connect your story to the issue. So whether you're advocating on access to mental health and you want more services or you want more funding, explain why that's important. Because authenticity builds rapport and it's going to leave a lasting impression. Next up, be visible. Start attending committee meetings at the legislature, or if you work a 9-to-5 job, watch them online. They record them. Our legislator has a great website. I don't know if you've ever seen any other legislatures' websites in other states, but ours really is great. They have it recorded and you can watch it in the evening, on the weekends, whenever. Be sure to say hello to legislators when you see them at the Capitol. If you've already met them in person, that's the first step. But then when you see them at the Capitol, they might think, oh, they look familiar. Go ahead and say, hi, Representative so-and-so. We met at your office, shake their hand, and remind them of your cause just briefly, because they don't need that long spill again. They just need a quick reinforcement. Connect on social media. A lot of legislators are on Facebook, and a lot of them are on Twitter, and let them see your typical life, especially if you have children or yourself, like your day-to-day life, because you also need to let them know that you're human as well. Invite legislators to community events pertaining to your issues. So if your district legislator is, in your town, say, hey, we have this rally coming up, or we've got this suicide prevention walk coming up. I would love to see you there. And you might love to see them there, but legislators also have to get reelected. So they're going to want to come to these community events as well. Participate in political events, conferences, etc. These are another great way to get your face out there for these legislators to see, and they'll also see that this is important to you. Number 4, be a resource. So I like this term, be a fountain of facts for the legislator, remembering that they have numerous issues to learn and to vote on. Before I started advocacy, I really had no clue what it all entailed, but they have so many things to vote on and to learn about. And so advocates, it's our job to really help keep it concise and consistent and give them that information in a clear way so they can vote on issues accordingly. Always be truthful, never mislead. Your personal credibility is at stake. This one is so important if you want to continue your relationship. If you don't know the answer to their question, don't make it up. I say this from experience from many years ago. Do not make it up. Say, I don't know that answer, but I will research it and I will get right back to you. They will be appreciative of your honesty, but also that you'll follow up with them, and be sure you do follow up. Building your reputation as an expert on your issue will lead legislators coming to you for info when they need it. So while you might be there advocating for one specific mental health issue, they might have another bill come across their desk and be like, I really need some help on this. Let me call Katie, or let me text Katie and ask her if she can explain this, or if she knows anything about this. That is a huge thing, and it really shows the importance and the value of a relationship when you finally get to this stage. And they will do it often. Have an attitude of gratitude. So when we advocate on issues that affect us personally, our emotions can be really, really high, especially when leaders don't vote the way we want them to do. And I had to learn this back in 2016, and I maybe said some harsh words, unless a few legislators said some harsh words, but we have mended that relationship. And going forward, I want to explain to you all that, we have to keep our emotions in check and be thankful for the things that they can do to help us. So remember, legislators are human and we all have different beliefs, but they can still help you pass and promote laws for your cause specifically. So while they might vote no on something, the next year they might say yes, or maybe they'll carry a bill for you. So be sure not to burn a bridge. Social media shout outs can go a long way, especially on Twitter or Facebook, where they can reshare it to their own feed. We just really need to show our appreciation. If a legislator appears to be very supportive of your issue, cultivate them into a champion for the cause. I know Senator Luno has carried many of my mental health bills. As you saw earlier on the thing, Representative Turner. We also have Senator Duplessis. You know, they're carrying a lot of bills that have to do with mental or behavioral health, and we want to continue that. That means they've built strong relationships with advocates along the way, and maybe mental health is, you know, personal for them as well, but maybe not. You know, it doesn't matter where they're coming from to be a champion for the cause. And congratulate them on their successes, give them shout outs again on social media, see them in person. If they won re-election, whether you voted for them or not, remember, it's not about political party, but it's about how we can form a relationship so that both sides can be helpful to each other. And then showing your appreciation in person, in writing, or online reinforces that your relationship with them is worthwhile, and that's very important. Okay, so I reached out to a few legislators and asked for their input on how to build relationships with those in the Capitol. So Representative Mandy Landry, I'll give you a few of hers. She said, know your material well, and remember, if you don't, go research it. Always have an ask in meetings unless it's truly to educate them or help them vote on an issue. Know how to approach. So some legislators are fine with direct messages, especially on Twitter or Facebook, but others are not. So in that initial meeting, you could ask, you know, how could I reach out to you informally rather than through email? And they'll let you know. So Senator Royce Duplessis, be authentic, information and data are helpful, and give real world experiences. Because when we just talk about our issues in a grand scheme, it's hard to really understand it in our day-to-day life. So give real world experiences of your issues and how to fix them, because no one understands like us who live this life. Next up, Representative Thomas Presley. He's also become one of our mental health champions, all of these actually. Take time to introduce yourself before session to build a connection. And so now is the perfect time. We've got just over a month before session starts. And so now we need to start meeting with our legislators to build that rapport before. During session, be mindful of time. So we might go to talk to a legislator that we've built a relationship with, and maybe they seem hurried or distracted. And he said, you know, they might have a bill coming up, or they may be focused on a meeting, and they might need to circle back. So we shouldn't get our feelings hurt if they kind of dismiss us in a way. And then lastly, be open to feedback and compromise when possible. And that's really important when you're advocating on legislation. And then I thought it would be interesting to ask a legislative assistant, Farah. She said, be personal when you reach out, start conversations seeking to understand the legislators first instead of assuming. This happens a lot in advocacy. So if a legislator votes on something that we disagree with, maybe we could ask them, what do you mean by fill in the blank? Or can you explain to me your stance on fill in the blank? Because once we understand where they're coming from, we can use that to our benefit to understand, okay, so if they're thinking this way and we're coming at it from this way, what can we do to, you know, bridge the gap? So that we can both, you know, get what we need, as well as pass meaningful legislation that's supported by everyone. So I really liked that suggestion from Caitlin. Relationships are two-way streets. Legislators need to know the value in their relationship with you. So maintaining and investing in it makes you a valuable resource for them as they vote on critical pieces of legislation year after year. So it's important for us to remember that while we're kind of seeking their relationship and it seems kind of one-sided, it's not really, because they are just one person in their district and they have tons of advocates and people coming at them. So we just have to remind them, showing them our face, reminding them of our cause through all of the ways I gave you before. But they also in turn, you know, we have to hold them accountable as well. You know, they said that they were going to do this, and then did they? And if they didn't, then we need to follow up with them, email them, call them, you know, say, hey, what happened there? Because in a true relationship with a friend, we don't just loud cap them on social media. Speak from experience, but you know, so we want to work with them one-on-one to figure out where the issue is and how can we fix it so that going forward, everyone will be on the same page. And then lastly, you'll see this group of advocates and 2 legislators, Representative Adrian Fisher, and then on the side, Representative Larry Selders, who are big in the mental health field and in the Capitol. When we work together, we can achieve far more than we can alone. And we'll usually also find greater joy in the work. It's all about relationships. So I hope this was helpful to you as you begin advocating this year as well as next. Please reach out to me if you have any questions. The alliance that I work for, we do a lot of legislation. We're up at the Capitol every year, and we also help share information to just our constituents, members on Facebook or Twitter or Instagram, putting out more information to help destigmatize mental health and just show people that this is an everyday thing. It's normal, but we also need to fund it and adequately address the needs of Louisianans in the Capitol. So I would love to hear from you. If you have questions, reach out. My email is right there. And thank you so much for allowing me to present today.
Hi, my name is Frankie Robertson, and I am the founder and president of the Amandla Group. It's a social justice consulting firm focused on addressing the social, political, and structural determinants of health that impact the overall health of Black and Brown birthing people. I'm a mental health advocate, I'm a lobbyist, I'm a community educator, I'm also a doula. Most importantly, I'd like to share with you is that I am a perinatal mood disorder survivor. I delivered my daughter, Zoe Amandla, the founder namesake of my organization, at 28 weeks. And after experiencing that very traumatic birth, I found myself dealing with postpartum anxiety and also post-traumatic stress disorder, which is fairly common for parents who have had children who have been introduced to the NICU environment. So I'm here today as an advocate, as a lobbyist, as an educator, and as a person who has experienced a mental health disorder. So I'm really grateful to be here today to talk to you about how an idea becomes a law. So thank you for joining. So first, I'd like to say that every law begins with an idea. There does not have to be a subject matter expert. You don't have to have a certain type of degree. You don't have to have a certain type of background. But what you do need to have is an idea and a certain level of commitment to see it through and to inspire others to rally alongside you to promote your cause. I'm grateful that over the years, I've had an opportunity to advocate for the creation of laws as a volunteer, but also as a professional lobbyist. So I'm here today wearing multiple hats, having worked in various stages in the development of creating a law. So first, I'd like to get started with a little bit of technical information about how a bill becomes a law. So I've already stated that it does not take a certain type of person, right, to advocate for a law or to be involved with creating a law. You can be a medical provider, you can be a mom, you can be a dad, you can be a person that cares about a particular subject that has impacted someone you know, love, a family member, or something that you've just observed in general in our society that needs a tweak or an adjustment or just a full makeover, right? That's where our policymakers will focus on the state level today, come in to help us modify laws, create new laws that address the cause that you care about, to address the thing that needs to be adjusted in our society. So today we're talking about mental health. And one of the things that I'm really excited about is that last legislative session, the organizations that I work with, March of Dimes, National Birth Equity Collaborative, Institute of Women in Ethnic Studies, Birthmark Doula Collective, and so many others, had an idea. An Institute of Women in Ethnic Studies, I can't remember if I said that, but we had an idea. And that idea was to ensure that moms are receiving the appropriate screenings for perinatal mood disorders throughout their pregnancy and after. And we knew that our state had certain indicators that showed that there was inadequate support for moms, and it began with screening. So we approached a legislator. That legislator was State Senator Royce DePlessis, and he became our legislative champion that sponsored our bill to mandate perinatal mood disorder screenings for moms during pregnancy and in the postpartum period. And we work with him throughout the legislative session to make sure that that idea became a law. So again, we'll talk about the technical side of this, but hopefully, as I've just described, it started with an idea and we were able to work with a legislative champion and see it through. And I feel very confident that so many attendees today will be able to take their idea and also take that idea to a legislator to see that idea through to make sure that the things that you care about have an opportunity to become a law to provide our state what it needs in terms of better mental health outcomes. So let's take a trip on how a bill becomes a law. So, as I've stated, it all starts with an idea. And with that idea, there are opportunities to approach legislators at the state level. There's a simple way to identify who your legislator is. If you do not know who your legislator is, you can simply hop on your smartphone or your computer and go to legis.la.gov. That's legis.la.gov. And that will take you to the state legislature's website. And once you are on that page, if you go to the left side of the page, in the first column, there's a section that says, who are my legislators? If you click there into your address, it will tell you who your legislator is. It's always a good idea to start with your legislator. If you can, reach out to them, assuming you don't already know who they are and don't have a relationship with them. Let them know that you are their constituent. Why is that important? For a few reasons. That means that you, as a member of their legislative district, has a lot of power as it relates to their standing as a legislator or as the representative of your district. What that means is that you are a resident of the area that they are designated to represent, and you have an opportunity to vote for them or not vote for them. And that holds a tremendous amount of power. And also oftentimes allows you an opportunity to have a voice with that legislator, whereas others may not have such a high level of influence. So if you can, start with your own legislator, but you don't have to actually just work with your legislator. Any policymaker on any political side, Republican, Democrat, Independent, is there to really serve you, and you can reach out to any of them. But let's say you decide to reach out to your legislator and you place a simple phone call. You can introduce yourself, let them know that you live in their district, and that you would like to talk to them about an idea. Chances are you will not get your legislator on the phone. They're not going to pick up the phone when it rings. They're going to have a legislative aide. But one of the things to know is that that person is pretty equally as powerful as a legislator. They are what we like to call or refer to as the gatekeeper to that policymaker. So you want to start with them, get to know them, and let them know that you'd like to schedule a meeting with them or with a legislator to discuss your great idea. Hopefully that conversation will result in that legislator or another legislator, right, becoming an author of the legislation that you would like to talk to them about. So it's good to go into that meeting with some level of research to know exactly what you're asking for, meaning it's a good idea if you have examples of legislation from other states that explain what you are trying to accomplish. If there's other examples that have been successful or even not successful in other states, that give them some sort of blueprint on what actual bill language might be. But if you don't have that, that's nothing to be discouraged about, because each legislator has access to staff attorneys whose job is actually to work on complex issues like drafting legislation. So if you take them the idea, the problem, a potential solution, then working together collectively, you can actually develop a piece of legislation that that author can present to their peers. So here's what happens. The bills are presented in the House. They're read a few times. That's called introduction. After going through first and second reading, they are assigned to what's called a committee. In our state legislature, committees are formed based upon different topics. Depending on your bill, it may be assigned to one particular committee because it fits within that topic. The bill that I gave you an example of, which was the perinatal mood disorder screening bill, it was assigned to a committee called Health and Welfare. So That committee is one that has a lot of health legislation that is filtered through with committee members who are accustomed to working with medical related issues. So your bill would then go through a committee hearing where several legislators will sit as a part of the committee. The public is welcome and it is encouraged to come and state their concerns either for or against the particular piece of legislation discussed at the committee hearing, including your bill. You have an opportunity to speak in the committee hearings or provide written communication as well. You have an opportunity to assemble other advocates who care about your legislation and the issue or cause that you are concerned about, and you're able to invite them to participate as well, or send in letters, send in emails, send in communication to inform and educate those committee members about the cause and why it's so important to support it or to not support certain legislation that may impact you. And that's a different conversation. From there, the bill either successfully makes it through that committee or it dies in committee. There's a few technical things that can happen in the committee, but those are pretty much the two basic steps. If the bill is successful, meaning it receives the appropriate amount of votes to survive the committee, it advances to the House floor for debate and vote throughout the entire House, throughout the entire House of Representatives. So what that means is that all of the legislators that are present that day who are members of the House of Representatives will have an opportunity to vote on that legislation. So once the bill advances to the House for a full vote, it can actually be reported favorably, meaning it passes, or it can actually die on the House floor if it does not receive the appropriate number of votes to advance. If it passes the House, then it's a pretty simple procedure that it goes through the Senate with basically the same process. So basically, we're about to repeat that same process, right? On the other side, working with members of the state Senate. So from there, it will go through a Senate committee hearing as well. And you're basically repeating the same process, but with different individuals and a different committee. If the bill successfully passes through that particular Senate committee, it will then go back to the Senate floor where it will have a debate and vote. So from there, if everything is successful, it will be sent to our governor where they can sign it or they will veto it. Signing it into law means that it's successful. Vetoing it means that he said, no, he is not advancing the legislation, and then the bill can die. But prior to that, there's also a few more technicalities. For example, if the bill does not look like it did when it leaves the Senate floor, as it did when it was introduced to the Senate from the House floor, then it would go into what's called a conference committee, where a designated group of legislators will basically work together to work it out, right? And then present that bill. And if there's a favorable conclusion, the bill will advance to the governor. If not, then that bill will die. So as you can see, there are a pretty significant amount of steps that an idea must go through before it actually become a law. But the thing to remember is, although this policymaking, lawmaking process can get a little complex at times, the laws that we have gone through this process, right? And this process is a fairly balanced process, with a lot of checks and balances. And it would not be a process without you engaging in these efforts and educating policymakers throughout the process. As constituents, our voices are very necessary, very powerful. We are educators. We have the lived experiences. We are at the grassroots level where we see issues. And because of our level of awareness and because of our passion, we are able to go to those individuals who we have elected to represent us, to influence law, to be able to educate them on the things that we need in the community. So without us, there is no them. Without our expertise, without our passion, without our lived experience, there really is no process, right? So one of the things that I like to share is that advocacy is a very important process. There are different reasons why individuals engage in advocacy. Oftentimes, individuals have some level of personal experience that has caused them to activate, caused them to stand up against an injustice, or caused them to stand up to share their voice, to share their experience, share their story, to be able to influence the laws that are created in our state. And it is so important to understand where we are at this time. Our nation or the world has really lived through a global pandemic. We know that there are so many people who have been impacted as it relates to trauma, who are in need of support in regards to mental health. We know that in Louisiana, our state has a lack of resources available for our families to be able to get the type of support that they need. And there are so many areas that really need improvement to make sure that families have the appropriate support that they need to address mental health issues, mental health disorders, and crises as they present. And without the advocacy of the medical community, the average everyday person who sees a need that needs to be addressed, we will not have the appropriate attention on these issues that we need to have to be able to fulfill the missions that we have as organizations, as individuals, as medical providers, as advocates. So I'm hoping that if there's someone that does have an idea that they would like to share, that would like to see it influence the laws in our state in regards to mental health or anything that you feel passionate about, I hope that we all have the tools that we need, the confidence that we need, and the support that we feel that we need to take that idea and present it, support it, and see it through so that it can become a law in our state to address the issues that we see need to be addressed, to improve health outcomes for everyone in our state, and to continue to strengthen our mental health system in our state so that people can receive the services, support, and everything that they need to live and thrive and be healthy. Thank you.
A United States Senator and Dr. Bill Cassidy, thanking you for your advocacy for mental health. We've worked together to pass many provisions to improve mental health access last Congress. Example, telehealth, school services, peer support services, I could go on. But we see evidence that the mental health crisis is worsening, particularly for those in underserved communities. And there's the ongoing crisis, if you will, of substance abuse and fentanyl overdoses. As the HELP ranking member, I am committed to working with everyone to improve access to mental health treatment for folks in Louisiana and folks across the country. I'm looking forward to working with you to make sure that every community in our state has the tools they need to combat this crisis. Thank you for all that you do. So much depends upon that which you do. Thank you.
So, hello, everybody. Thank you for joining us today for our presentation. We're representing the Office of Behavioral Health, and we're going to talk today about our peer programs and services. So I would like to introduce my colleague, Jamie Tyndall, who is our state coordinator for peer programs and services. And I am Charlene Gradney, and I work with community-based programs and services with the Office of Behavioral Health. So just to give a little overview of peer programs and services with the Office of Behavioral Health. So as lots of people know, peer programs, peer support services are an evidence-based behavioral health service that is provided by a qualified peer support specialist provider. So in order to be qualified, they've gone through the training, they've met the criteria, and they are in recovery themselves for at least 12 months. They have experience navigating the behavioral health network, and peer support services are often and most often a face-to-face intervention provided in the community, sometimes in the clinic, and face-to-face interactions with our service recipients. And peer support specialists function as part of the clinical team, supporting the team and the services and supporting the individual mainly who's receiving services on how to navigate the system. What are some lessons that they may have learned through their own personal journey of recovery that could help that individual in their recovery journey as well? And they support the members, those who are receiving services, with how to advocate for themselves, how to coordinate services, how to link to the appropriate service providers. So a little background on peer support programs in Louisiana. So the Louisiana Department of Health and Office of Behavioral Health has a long-standing history of supporting peer support programs. We began training as peer support specialists in 2008. In 2019, as part of the regular legislative session, Senate Concurrent Resolution 84 was passed, ordering the Department of Health to do whatever we could to make peer support services Medicaid reimbursable service. In 2021, peer support services became a Medicaid reimbursable service. In 2022, we passed Act 151, which revised current legislation in order to allow peer support specialists who have certain criminal offenses on their criminal record to be allowed exemptions by employers if they have at least 3 years has passed since they have successfully completed their sentence. We have also allocated various funding sources to support peer programs and services, including block grants, various grant resources, in addition to Medicaid. And we are part of the national movement to support the growth of peer support services and peer support specialists. We're going to talk a little bit later about the president's initiative to develop statewide, nationwide credentials and guidelines for peer support specialists. And that's the level of commitment that comes from not just Louisiana, but also at the national level with the federal government and the Substance Abuse Mental Health Services Administration. Just a little bit about Medicaid and reimbursement for peer services. So again, this was implemented in March 1st of 2021. This was the first phase of implementation for Medicaid reimbursement for peer services. We are still in that phase 1, with local governing entities being the provider type that is allowed to bill Medicaid for peer services. We are continuing to monitor and look at growth into other provider types and expand that Medicaid reimbursement option. And the service definition for Medicaid reimbursable peer support services is available online if you go to the Medicaid website. And just a little bit of information about how and who qualifies for this. So Medicaid members who have a behavioral health diagnosis and they are recommended by a licensed mental health professional to receive peer support services that is indicated in their treatment plan. Peer support services would be a benefit and support them in their recovery. Individuals, Medicaid members, must be at least 21 years of age or older, and again, have that mental health or substance use diagnosis, a behavioral health diagnosis. So a licensed mental health professional in the state of Louisiana would be considered a licensed psychologist, a licensed social worker, a licensed professional counselor, a licensed marriage and family therapist, a licensed addiction counselor, and APRNs with psychiatric expertise. So peer support specialist requirements. So again, for those who are peer support specialists, in order to qualify to go through the training and become a recognized peer support specialist in Louisiana, they must have at least 12 months of continuous recovery with a behavioral health condition that is demonstrated, and this recovery is demonstrated by a lifestyle and decision supporting the individual's overall wellness and recovery. The individuals must have successfully completed an OBH-approved training for peer support specialists, and they must also maintain annual continuing education units. And this is a requirement by the federal government as well, that there is a minimum number of continuing education units that are obtained every year, even after receiving that first initial training to become a peer support specialist. Every year, peer support specialists will also sign an attestation statement for their code of ethics, indicating they understand the code of ethics and will adhere to it. Peer support specialists have to be at least 21 years of age in order to bill Medicaid and have a high school diploma or a GED as the minimum education, and also receive at least 25 hours of clinical supervision from a licensed professional counselor, a licensed mental health professional before serving clients individually or independently without supervision, or being able to go into the field and provide services to service recipients. And supervisors of peer support specialists, in order to bill Medicaid, the peer support specialist must have a licensed mental health professional who is providing clinical supervision. And this is different from the clinical supervisor or administrative supervisor within your organization. This could be someone who's a counselor, a licensed mental health professional in your organization that's not necessarily your direct supervisor, but providing that clinical supervision to support you as part of the clinical team. Supervision, again, must be provided by someone who is a licensed mental health professional and has gone through an OBH-approved training for peer supervisors. And it's provided in a manner that is mindful of the peer support specialist providing the service, as well as the population that is being served. And again, more details about this are available in the Medicaid manual, and it goes into extensive detail on all of the requirements for the peer supervisor. And we have ongoing trainings, and we'll have more information available. If you want more information about trainings, feel free to contact our office as well. Service components for peer support services that are provided by peer support specialists. So again, utilizing the lived experience of the individuals of the peer support specialists is so critical in helping service recipients who are now trying to find their journey to recovery, and learning from your lessons learned, helping them learn how to advocate for themselves, how to overcome barriers to accessing treatment, how to advocate to get the resources needed, how to help set goals that are effective, attainable, and has the service recipient's voice and needs reflective in those goals. And also encouraging the members to be engaged and active in their own recovery process, and in creating their treatment plans, their plans of care, the services they're going to be linked to. So there is so much value in the peer services that peer support specialists offer through their own journey of recovery, through their own lessons learned, that helps others to hopefully learn from your journey and may have a successful journey to recovery that is maintained for their lifetime. Some exclusions, things that cannot be billed as peer support services to Medicaid. So sometimes we hear lots of times that peer support specialists are not used to their maximum benefit, or people don't understand how to use them. So there are some ways we want to make sure they are not being used. They should not be used for recreational, social, or leisure in nature. Anything that peer support specialists are doing should have a therapeutic or programmatic goal attached to it that is linked to the individual's treatment plan and their plans of care or their goals for recovery. Peer support specialists are provided typically in the community or in the clinic. We want to make sure that they are used in that way and that they're optimized. They're not just transporting, though. They may help to get an individual to their medical doctor if it's the first time they haven't gone to the doctor in years, or trying to encourage them to take charge of their medical health and primary health just as much as their behavioral health. But the peer support specialists would not be used for just transportation. They should not be used for general clerical or office tasks. Of course, we want them to learn how to do documentation and support them in developing that skill set. But for general office and clerical tasks, that would not be an appropriate way to use peer support specialists. And just attending routine meetings like support meetings, NA or AA would not be an appropriate use of peer support specialists, or transporting clients to that service. Really, the goal is to have them be supporting them in their recovery in a programmatic way that ties into their treatment plans and their plans of care. Let's see, now I'm going to turn it over to my colleague, Jamie, and we're going to talk about our peer trainings and what's our next steps with that. So Jamie, I'll turn it over to you.
Thank you, Charlene. I'm going to talk a little bit about the peer trainings. I appreciate that introduction. Okay, so we're going to talk a little bit about the peer trainings and a program overview of those. The purpose. So what's the purpose of the peer trainings? And we're here to support ongoing trainings in various areas related to peer services to promote the ongoing growth and development of peer services throughout the state. State of Louisiana is Office of Behavioral Health very interested in peer support. We know the outcomes are great, and so we are really on board with peer support services. And the goal is to provide trainings and resources that support the growth of peer support services through the following objectives. So first, we have our Louisiana Core Peer Support Specialist training. That will increase the number of recognized peer support specialists in the state of Louisiana. And then we also are rolling out our peer supervisor trainings, and that'll increase awareness and improve utilization of peers in behavioral health settings. And we're rolling these out sort of together, and they kind of have the same basis in the curriculum so that we can also train the supervisors and those managing peer support specialists in all aspects of services, of peer support services. The new program is currently being established to develop a web-based continuing education training for peer support specialists and online peer database. Charlene mentioned the CEU requirements or the training requirements to remain in good standing as an active peer support specialist in Louisiana. And so this website will allow those trainings to not only be live, but be recorded, available, easy to find for the peers to have ongoing professional development opportunities. So the Louisiana Core Peer Support Specialist training right now is contracted through the Extra Mile Region 4. We had a Train the Trainer series with Appalachian Consulting Group where we developed the curriculum that we're using, and monthly Louisiana Core Peer trainings with qualified applicants seeking to become recognized peer support specialists. We're kind of amping those trainings up a little bit because we do have a lot of peers registering to take the training. So we're excited about that. The peer supervisor training, that also is a contract with the Extra Mile Region 4. And the Train the Trainer will be held with Dr. Peggy Swarbrick. And we'll conduct peer supervisor trainings as needed with supervisors and clinicians in the field working with peers in a behavioral health setting. That is just now rolling out, and we're currently looking for facilitators, and we have an application process for facilitators of those trainings. And then we'll begin to have the trainings for clinicians, even peers that are supervising other peers in any setting. Is going to be a great addition to this peer support specialist training. The peer continuing education series and online database is coming soon. So this will provide monthly continuing education opportunities for recognized peer support specialists, develop and maintain online database for peers to upload their certificates for training, continuing education units, and submit required documentation for annual renewals. This will make things a lot better and streamlined for peers to be able to access the trainings they need and keep up with their CEUs, and make sure that it'll also be used as a community board between the peers, and just a really great addition to our peer support services program. And peer training. So since implementing the program in 2008, over 800 individuals have been trained as peer support specialists. Currently, there are nearly 400 recognized peer support specialists in Louisiana with active status. In 2022, we developed and implemented the Louisiana Core Peer Training Curriculum that I spoke of a few minutes ago. And in 2023, the implementation of the new Louisiana Peer Supervisor Training Curriculum. So as we present this information to you today, we've rolled out the Louisiana Core Peer Support Specialist Training Curriculum, and it's in full swing, and we are rolling out the Louisiana Peer Supervisor Training Curriculum. So a little bit about the peer community-based programs. So the purpose of these programs is to support and promote the proper utilization of peer support specialists in various community settings throughout the state. You heard Charlene share earlier the purpose of peer support specialists and what their tasks are and what their tasks should not be. And so that was great to clarify as well. So we want to make sure that it goes a little bit further, and all the peer community-based programs are just following suit in the same line and properly utilizing peer support specialists. The goals and objectives here are to provide resources to support the most effective utilization of peers in various community settings. to support recovery-oriented system of care. So one is Target Health Peer Support, and it trains peers to lead peers in a group setting focusing on whole health management. Peer and adult and youth inpatient facility to support discharge planning, and campus peers in higher education settings to support students with behavioral health and/or emotional challenges. And we know that that transition into adulthood and on campuses and university campuses and such is really a trying time. And a lot of times there is a lot of support needed in that area to help the peers succeed. So the Target Health is a tremendous whole health approach offered by the Louisiana Mental Health Association contract. And it's a train the trainer, facilitation of Target Health groups in all 10 local governing entities annually. So they are in all 10 regions of the state, and quarterly steering committee meetings with Target Health facilitators. And those quarterly meetings are held to see, hey, do we need to change anything in the curriculum? Do we need to update anything? Are we current and up to date on cutting edge information to be offered? And peers in inpatient settings, through contracts and partnerships, employment of peers to work in the adult and adolescent units to support discharge planning efforts. Again, you know, a positive discharge from a hospital is so important, and to know that they have a peer that they can reach out to that can help them through the discharge planning efforts is just it's just critical. And the campus peers in higher education settings. This is still a work in progress, but we're beginning to roll this out, and it provides campus peers to universities throughout the state to support students experiencing behavioral health and/or emotional challenges. Provides proper training and supervision to the campus peers, and all the campus peers will also go through the peer support, the Louisiana Core Peer Support Specialist training as well. Outcomes. What do we expect? Target Health. They will provide resource to peers working in the behavioral health field to support their whole health and recovery. In fiscal year 23, 19 groups conducted with 190 participants statewide were held. Peers in inpatient settings, peers as persons with personal lived experience with behavioral health conditions provide support through this discharge planning process in efforts to ensure a successful discharge to the adults and youth who are being discharged from an inpatient stay. Peers in higher education settings, trained campus peers will provide support, guidance, and referrals to students who are experiencing behavioral health and/or emotional challenges as they transition to this next phase in their early adulthood. We already know who better can relate and speak to peers than peers themselves. Someone who's walked the walk, who's lived the experience, who has victories in their life to help others. So that's really what peer support's all about. But on the higher education settings and inpatient settings, Target Health, this is a very well-rounded approach to reach many different populations. That's the end of our slide presentation today. Thank you so much for joining us. I'm not for sure if they'll have Q&A at the end of this, but we really appreciate your time. Thank you so much.
My name's Ken Brown, and I'm a teacher in Calcasieu Parish, and I'm also CEO of the Peer Initiative. Peer Initiative is a nonprofit that focuses on teen suicide prevention. We got started in 2014 when I was teaching, and my son was also a freshman at the school I was teaching at. And we lost 4 students between February and November of that year. And at the end of the year, we were just trying to figure something out. We knew we had to do something. And so we turned to a specific point that had happened during that year. And we used that as a impetus, as a source of inspiration for the Peer Initiative. And what that impetus was, what that inspiration was in February of 2014, when the first student died by suicide. That student was a friend of my son's. And that day, that night when we're discussing what would happen, we're trying to decide if my son should go to school the next day. We finally come to the decision that he wants to be near his friends, so we let him go to school. And then, so the next day, at the end of the day, we ask him how it went. And unfortunately, if you're familiar with those things, you know that the way it generally works is that if there is a tragedy like that, the school system typically sends in a team of counselors, a crisis team to the school to be on call and meet with the students as needed. So when my son got home that day, I asked him how the day went. And he was like, "Dad, they sent in the counselors." His words of a 14-year-old, "they were terrible." I'm like, "Okay, son." He said, "But here's what did help." And so what happened is a senior who 4 years before had been across the street at the middle school, and he had lost a friend to suicide. So in 2014, when it happened again at this school, when he's a senior, he went to the principal and asked if it was okay if he would go in and talk to that freshman class that had just lost one of their own. So we went into my son's class, and he talked to him. And my son said, "Dad, that's what helped. That's who we need to talk to. We need to talk to somebody our age, somebody that can relate to us." And so, like I said, fast forward to November, when we're trying to decide what to do, that's the idea we built upon, peer support. And so we started this program. The program is partnered with McNeese State University with their psychology department. We have trained professionals from McNeese come out and work with our students and train them to be peer support personnel. They get trained in empathy, non-judgmental support. They actually have mock peer sessions where they work with these experts from McNeese to go through different scenarios they might encounter. They have a confidentiality agreement they're required to sign before they're able to meet with someone. And they actually go through a year of training before they're allowed to sit in the room with another student. McNeese also has what's called the K-Dory Counseling Clinic. This clinic is where the students who are going for their LPCs have to get their clinical hours. And so the partnership we have with that K-Dory clinic is if one of our peer support team members is in a session and a student does say something to the effect of, "I want to kill myself," then our students would hand that student in distress over to that K-Dory clinic. That K-Dory clinic comes to the high school and provides licensed counseling at the high school at no cost to the student. So this program has been in effect since 2015. We've provided over $100,000 of mental health help to students in need. And that's at $20 a session. The K-Dory Clinic has given us a rate of $20 a session. So I'm horrible at math, but if you want to do the math, that's how serious the problem is over the years. I can tell you that right now, MCAL, which is Imperial Calcasieu Human Services Authority, they're providing the funds for our services from K-Dory now. And I believe it's somewhere in the proximity of $20,000 a year for those $20 sessions. So that's who I am. That's the program we have. And it's unfortunate that we have to build these programs in high schools like this. It's unfortunate that the support, the mental health help isn't already in the schools. And that's why it's important we have advocates. That's why it's important that you're here doing what you are today, because that's what we need. We need voices out there speaking on, on behalf of these students, and talking about the need, the crisis that's in our schools, and the need for mental health care for our students. And since I've been doing this over the last 8 years, I've come to a realization. And in this room, the people that are gathered here, virtual room, we're advocates. So it's not so much this room that I'm speaking to here, but more of the general public. And we know the stigma that exists with mental health and suicide in particular with the general public. That's one of the biggest barriers that we fight when we're trying to save lives from suicide. And so here's what I've realized. Teens are relying on adults who won't speak about or acknowledge the teen mental health crisis to solve the teen mental health crisis. I'm gonna say that again. Teens are relying on adults who won't talk about or acknowledge the teen mental health crisis to solve the teen mental health crisis. And as you can imagine, that's a recipe for disaster. That's never going to work. So what's the answer? The answer is that the teens can't rely solely on the adults. The answer is we're going to have to empower the teens, give them the training, give them the platform, give them, whatever they need so that they can save themselves. And it makes sense that if this is going to be happening, that, when we're talking about advocacy, that we actually give the teens a voice, in fighting to save their own lives. So.
Hi. Hello.
So what I was saying is it's important that we actually give teens a voice this is awkward.
Awkward for you.
Okay, I'll see what's going on here. I just said teens need a voice, but
It's me.
I'm a 53-year-old white man.
Right.
We've been speaking on behalf of people, anybody. We can speak on behalf of anybody at any time for anything. Trust me, we've been doing it for years.
Right. So let me take a turn.
You think you can do better?
Yeah, I think I can.
This is awkward, but okay.
Hello, my name is Julia Oj. I'm a senior at Sam Houston High School. I have always had the drive to help others, and halfway through my time.
You sure you got this?
Yes, I have. I got this. Yeah, pretty sure. Halfway through my time at Sam Houston, I have finally found an outlet to do so. I started to attend the pilot club meetings here, and I was soon interviewed for the peer support team, a group of student counselors to aid in the student body's mental health. Sam Houston recently took part in the My Ascension Rally, a gathering of the student body to view the documentary style film My Ascension, starring Emma Benoit and her life story of surviving a suicide attempt. When the film was over, I felt the Lord move in my heart, and I acted immediately. I had asked one of our librarians for the microphone at the rally, to which she graciously handed to me, and I began speaking to the crowd. I began preaching about Pilate's goal, the fact that nobody is alone, judgment does not exist when seeking relief, and you are not less than human because you are thinking of hurting yourself. Help is available, and just because we're emotional teenagers doesn't mean my feelings are invalid. Little to my knowledge, Mr. Ken Brown was in that audience and recruited me after listening to my speech. I was then presented with the opportunity to become the first Peer Initiative Youth Advisory Board member and PST facilitator, which I very excitedly accepted. In my time as youth advisor, I have aided in bringing the American Foundation for Suicide Prevention presentation to every classroom at my high school with guidance from our school counselors. I am Safe Talk and Assist certified, which makes me qualified to handle a situation in which a fellow student is struggling with deteriorating mental health. I've attended training at the McNeese Center with Dr. Yadis, and I'm among the few student counselors who take time out of their week to sit down in person with a student and talk about their problems. We as a group do not do this because we must or for monetary gain, but rather because we wish to see a change. My fellow PSTs and I have a passion for mental health and teenage advocacy for suicide. Today's stigma surrounding teen suicide is this: teenagers do it to seek attention. It is a sensitive and touchy subject. If we say the word suicide, we will put that thought into their head and they could potentially act upon it. But the truth is, we cannot make people think a certain way. Suicide is not taboo to talk about. Suicide is not a bad word. The bottom line is that a problem that is not talked about is a problem that won't be solved. So let's talk about suicide. In 2020, arguably one of the worst times of our modern nation, nearly 46,000 individuals died by suicide. If we assume that every person who has taken their life knows at least 2 people, 92,000 people would be affected by this statistic. Considering this, it is safe to assume that you have encountered someone who has some relation to suicide. And in the halls of a high school, it is guaranteed that you will come across someone who has suicidal tendencies. There isn't a day that goes by without hearing the phrases, "I'm going to kill myself," or "I can't do this." Whether it is said in a joking manner or not, it cannot be taken lightly. So why teenage advocacy? Why should 17 and 18-year-olds bring awareness to teenagers' mental health? Why Teens for Teens? And the answer is simple: validation, relatability, understanding. And according to Maslow's hierarchy of needs, every human being requires relationship, security, and a sense of belonging. And because of the amazing sponsors and supporters of Pilot, we can now professionally train our age group to listen to teenagers and offer advice because we are experiencing the same issues and hardships. I raise awareness for them because I am them. I am walking the mile in their shoes. I understand the struggles, the addictions, and stresses that we face daily. And as a victim of addiction, I often see students come into our PST meetings and we cannot help with their addictions due to the lack of resources. Vaping, drugs, alcohol, and pornography, all we have to offer is support and encouragement. So it begs the question, how are we supposed to help someone when no one is in the position to do so? When we have no resources or proper guidance, how are we supposed to help? There needs to be a change. And the Angels of Grant was the key to that change. It is now possible to offer Safe Talk and Assist training to all teachers and students who are willing to come forward and answer the call to aid teen suicide prevention. It is now possible to place an addiction relief program within our walls. It is now possible to spread peer initiative throughout Louisiana and raise awareness on a mass scale. This organization is so much more than a club to me. I feel as if I found my calling and look forward to pursuing this in college. I believe in the future of students supporting their own peers, and we've proven more than worthy than carrying the future of teen suicide awareness.
Thank you, Louisiana Mental Health Association, for inviting me to share a few thoughts with you on the Louisiana Mental Health Coalition. My name is Ruby Noble Evans, and I'm a family member and an advocate, and I've been one for a while, and it is my personal passion. It's certainly what brought me to involvement with the coalition. So some background. The coalition formation began in 2018. Why was it formed? A group of like-minded founders believed that mental health needed an active voice in the advocacy arena. It really, in many ways, had no voice at all, unfortunately, for various reasons, but it needed a voice. Where at the state legislature, but not only there, at times on the federal level, at Congress, for education, for sharing resources, to advocate in all possible arenas for our common truth, a truth that I know is shared by you, me, and the coalition, that those having mental health needs and their families and communities are not alone. The founding partners are Volunteers of America, Southeast Louisiana, the Louisiana Mental Health Association, National Alliance on Mental Illness, Louisiana, and also its affiliate, NAMI New Orleans, the Extra Mile, and Via Link. A lot of the advocacy partners that many of you know, providers, both public and private, faith and policy groups like the Catholic Charities and the Louisiana Public Health Institute, Louisiana Budget Project. Also individuals with lived experience, both personally and through family journeys, folks like me. What did we do as the formation began and actually throughout our years of impact with advocacy for mental health? We quickly established 3 core principles through a process of reaching out across our state for input. Here are 3 principles. People with mental health needs should have access to sufficient community-based services and treatment such that they can live an integrated and independent life. They should have access to high-quality mental health services and treatment. And they have the right to participate in treatment decisions. These, the word I use mostly is basic. These are as basic as can be. They are universal. I've not met anyone or any group yet with my advocacy journey and the coalition's work that did not agree on the importance of these principles. So through the first years of the coalition, we held regional meetings. We did surveys of our stakeholders. We built a partner base. What does it mean to be a partner? There is a memorandum of understanding. You would sign on. Most of what we have in our partner base are groups. Some of the types of partners that I just talked about, but we also have individuals who have signed on to be partners. We've also built over time and continue to build a stakeholder list for communications. We identified the highest advocacy priorities to bring focus to our work and impact. Currently, those priorities are community-based crisis services, criminal justice and reentry, and school-based mental health. A quick shout out to a couple of our partner organizations providing leadership in these areas. Criminal justice and reentry, Clarice Gallegos of Focus Clubhouse over in Lafayette, and school-based mental health, Jared Crespo of Via Link. So those are our 3 priorities. And how do we use them to bring a voice to mental health? Again, we communicate, we educate, we share resources. We provide direct email communications to our stakeholder list and encourage our stakeholders to share them with their networks. We forward communications from our partners and other resources, on a variety of topics, but particularly those affecting our priorities. Again, priorities identified through consulting our stakeholders. How do we ensure impact? We have work groups built around these priorities. We advocate, we have legislative advocacy, and we have advocacy and liaison with our executive branch decision makers. We build relationships, go to the state capitol. We provide a voice. We are a voice at the committee table and the legislative halls where decisions are made. Again, that focuses on the legislature, but the executive branch is a critical and necessary partner in the work of the Louisiana Mental Health Coalition. Governor Edwards, any governor of our state, but currently Governor Edwards, and the Department of Health. Governor Edwards, I'm going to offer a quick story just to acknowledge the leadership that Governor Edwards has provided over time for mental health. A gentleman who's now deceased, but was at the time the head of the state office of mental health before we consolidated behavioral health into behavioral health. We had a state office of mental health, and that fellow's name was Warren Taylor Price. He invited a fellow advocate, another family member, and me to meet, have coffee with then state representative John Bell Edwards. This was long before the 2016 election cycle. And in that meeting, Mr. Warren Taylor Price announced that Representative Edwards was running for governor and would be a consistent supporter for mental health. Well, y'all know the rest of the story. Rep. Edwards became Governor Edwards. And I'm here to acknowledge with thanks that what Mr. Price promised us as to Governor Edwards' focus on mental health has come to pass through the 7+ years of his administration. So advocates had long advocated for community-based crisis services. And here's an example of what the executive branch in partnership with the legislature has done to make crisis services a true continuum of reality. You know, this is over many, many years and decades, but particularly the Louisiana Mental Health Coalition had advocated for community-based crisis services network. Well, in recent years, Office of Behavioral Health head Karen Stubbs and her team have used federal and state funds and some department vision to make those services a reality, bringing 4 new crisis services statewide for adults with Medicaid benefits. This is front-end prevention, intervention, and diversion from more costly and more restrictive care, whether that care would be in a hospital setting or through intervention with law enforcement. So although we're in the last year of Governor Edwards' administration, Office of Behavioral Health has plans to build a foundation that would ensure adolescents with Medicaid benefits would have access to crisis services. So what we've done so far has been for adults, greatly needed, greatly advocated for, but even on the horizon, services for adolescents, front end, prevention, intervention, and diversion. So in 2023, the Louisiana Mental Health Coalition will advocate for funding to assure the statewide implementation of the new adult crisis services. As of now, the state budget picture looks very bright. We continue to have federal pandemic recovery funds flowing through to the state, and those funds are largely dedicated to human services, to behavioral health needs. Unfortunately, what we all know is the fallout from the pandemic has fortunately brought awareness to Louisiana's behavioral health needs. You know, we've had an unfortunate fallout, but we've had more of an awareness, I would say, actually more, in my experience, more of an awareness than we've ever had to our state-based behavioral health needs. So the coalition is going to watch for legislative proposals that would support our principles and priorities. Yes, for mental health, but also with our substance use partners. And we will be very careful to watch for proposals that would be detrimental to those for whom we advocate. On the federal front in Congress, we watch the federal budget. That has been a bright spot in the last year particularly, and what was signed into law by the president at the end of 2022, a bright spot for mental health. We watch for proposals such as those regularly sponsored by our U.S. Senator Bill Cassidy. I know all of you will join me in congratulating Senator Cassidy on recently being named to a very powerful and very important role for mental health advocates. He's on the Senate Health, Education, Labor, and Pensions Committee. So again, congratulations, Senator Cassidy. But back to the Mental Health Coalition in Louisiana. Our current focus areas are, again, community-based crisis services, criminal justice and reentry, and school-based mental health. We invite you to join a work group. These work groups will ensure the coalition has impact around these focus areas, these priorities. All of you are invited to become a partner. Just write me and let me know if you are interested. I'll be happy to send you the memorandum of understanding. All you really would write or sign on to in that memorandum of understanding is those three core principles, universal principles. And of course, that you would support and further the advocacy of the coalition. So you can be a partner or you can be a stakeholder. Just be added to our list that receives regular distributions of information, updates, legislative reports for the Louisiana session that will be coming in April. We'd like to have you on the stakeholder list if you're not already there. Something tells me many of you are, but let us know and we'll add you. In everything we do as a Louisiana Mental Health Coalition, we bring light to what has been for so long a darkness, a shame, and a stigma surrounding mental health. Whatever brings you to this conference, whether it's a personal interest, a professional interest, or both, we invite you to join us. Thank you.
Hi, good morning. My name is Lonnie Grenier. I handle public policy and advocacy for Odyssey House, Louisiana. I also manage the Coalition of Louisiana Addiction Service and Prevention Providers, and I serve as chair of advocacy for the Louisiana Behavioral Health Advisory Council. So this morning, I'll be talking with you about the legislative agenda for substance use treatment and substance use treatment providers, what we might anticipate, some successes that we're building off of. And I'll also talk about behavioral health advocacy in general and hope to give you some strategies, some tips to build your own advocacy agenda, but also how to be a successful behavioral health advocate. So primarily our legislative agenda is going to be focused this year around funding. Specifically enhanced funding for residential treatment. The governor recently presented his executive budget, and the legislature this year will go through their budgetary processes to produce their own budget, which we hope will be representative of the need that's intensifying in the community and the treatment that is needed to meet that need. So it is really time to strengthen our addiction treatment systems in Louisiana. Last legislative session, there were two pieces of legislation. One, a resolution around a needs assessment and asking LDH to work in collaboration with providers and DCFS and others to focus on the needs in terms of providing addiction treatment services throughout the state. But also what is needed within each region to make sure that anyone who needs treatment has access to treatment and that providers are strengthened and have the resources that they need to meet the need. So what we have also seen from last legislative session was a rate study HCR 111 required the Department of Health to produce a residential rate study across comparable states. And what we recently saw from that was that Louisiana is amongst the lowest of comparable states. We are in the 20th to 30th percentile for most residential rates. And we have not seen an increase for most Medicaid SUD residential rates since 2012. And so that will be our primary advocacy priority. We know that the Department of Health has initiated a provider rate review process, and we are very hopeful that when those SUD rates are reviewed, that we will see an enhancement. But what we are ultimately advocating for is an immediate enhancement by way of legislative increase in the budget. So that will be our primary legislative priority. We also know that because the legislature is sitting on such a surplus and an amount of funding to be spent, we are advocating for bricks and mortar for funding to help expand and to help meet the need in the community. We know that as provider agencies, we're tasked with a lot of challenges, but amongst those is making sure that we have the resources that we need to be able to meet the need in the community. And that includes having adequate capacity. It's not just about making sure that each individual has the appropriate amount of time in treatment, but it is also about making sure that providers have enough resources to meet the need in the community. And so what we know is that with Medicaid funding, a lot of these substance use services, particularly residential for our Medicaid and uninsured and underinsured populations, which are most vulnerable and at risk, we know that those services are covered by Medicaid. And so if we could utilize some of this funding to tap into it, to expand provider capacity and utilize it for bricks and mortar, which is honestly one of the most challenging and difficult things for a provider agency to be able to access and tap into, is bricks and mortar funding. So we are going to be advocating that some of the budget surplus funding be used for bricks and mortar for addiction treatment systems to help expand and enhance our capacity to treat Louisiana's individuals who are suffering with addiction. We also know that there are priority populations such as adolescents and women with dependent children who require specialized treatment settings and often specialized treatment curriculum to be able to meet their needs. We know that there's a significant overlap between women's health and child's health, but also child welfare. And if we can connect those pieces and help to support our state and our state agencies as they work to lay out a framework for how to move forward and how to best holistically treat and overall best treat Louisiana's families. I think that there is growing conversation around, again, the overlap between women's health and child's health, but particularly women's health and child welfare, and the impact that substance use has on Louisiana women and families. We need to recalibrate and take a broader approach around how we treat women and incorporate child welfare and the impact of children and families into the treatment of women. So we saw some very some great movement this last legislative session with the creation of an Office of Women's Health, which we hope will lead to better streamlining of our state's capacity to identify how best to treat women and to actually provide services for women. So again, what we're looking at this legislative session is to build off of some of the successes that we had last legislative session, but also some of these items that help lay the groundwork for ultimately what is going to be a really big advocacy push in terms of substance use treatment and strengthening substance use treatment and giving providers the tools and resources that they need to meet the need on the ground floor. So that is what I would like to cover in terms of substance use treatment and what providers are actually going to be looking to do this legislative session. We do have a legislative agenda, and we do have an array of asks that we continue to carry forward. But we're always going to be looking at how to increase the resources on the ground floor of service delivery to make sure that providers have what they need to help treat people on the ground floor. So now what I'm going to do is I'm going to talk about behavioral health advocacy and give you what I hope will be some useful tips in terms of crafting your own legislative strategy and being an effective behavioral health advocate. So first, what you need to know is advocacy is a continuous process. It's really not a single event. It's always happening. It occurs on multiple levels: local, state, and regional, national, international. It requires your constant attention. Whether you have an individual advocacy coordinator within your agency, or whether you are particularly interested in advocacy and you want to be a behavioral health advocate in everything that you do, particularly in your professional capacity, then you need to know that it requires constant attention. You have to constantly keep your pulse on what is happening, and know that it is about achieving specific outcomes, which include enhancing awareness around the importance of community-based treatment and the essential services that we provide, increasing funding and resources for services, facilities, as I discussed in regards to our substance use treatment legislative agenda, but also building more efficient referral networks and service delivery systems. That is a huge challenge, especially in our rural areas, is making sure that we all know what service providers are out there and what they're all doing and how can we stay connected, because historically substance use treatment and behavioral health providers overall have operated in silos. So it really does require advocacy on the part of the individual provider, but hugely important is collective advocacy where we can all come together. You have to be willing as a behavioral health advocate to position yourself and position your agency and the services that you provide top of mind. And it's important to identify the factors that go into determining who you need to tailor your message to and how you get it out. First of all is your audience. These include your decision makers, your influencers, your allies, your policymakers, and they are your key funders in Louisiana. These individuals set rates. They decide when and for what purpose funding can be spent, and they are hugely important in terms of being the primary beneficiary of your advocacy. There is also awareness, and awareness is made up of a lot of different factors, and you have to pay special attention to each of these factors in order to kind of ascertain what does this person know about your issue and how do they feel about it. And that includes their attention, their exposure to the issue, their perception and how they perceive what you're talking about, their comprehension, their understanding of your issues and what you're saying, their experience. Have they any firsthand experience with your issues, their level of empathy and their ability to relate. So determining your audience and your awareness is really key to helping craft your approach. Again, determining your audience and combining that with their level of awareness is really key to determining your approach. And there are two successful approaches in terms of how we advocate for behavioral health services. There are others, but I've identified two really successful approaches. You may have heard them before. They're called the heartstrings approach and the purse strings approach. Some people like to hear your message from the heart, and some people like to hear your message with numbers. And it is very important that you prepare your argument and you prepare yourselves for whoever your audience is and their level of awareness so that you know what your approach in that instance will be. There are also some essential challenges that are faced by community-based providers. And I think in order to effectively advocate, we have to identify and really understand what are the challenges that we face. Appropriate length of stay for our clients. In behavioral health, mental health, substance use treatment, that is a huge, huge issue, appropriate length of stay. It really just comes down to time and money and making sure that you have the funding that you need to be able to keep someone in treatment for a sufficient amount of time, or making sure that your funding sources and your payers are agreeable to authorizing that person to stay engaged in your services. And nonprofits, particularly community-based organizations, we have to know how to be creative with funding. We also have a lot of challenges with parity and the lack of. While insurers insist on undercovering mental health and substance use disorders, patients struggle to have access to care and the treatment that they need. And while there are enforcement mechanisms throughout the country in terms of enforcing parity, we have not seen any promising results in terms of how we might craft policy and move forward as it relates to parity. We also know that length of stay is tied to stigma. When patients can't stay engaged in services, the risk increases that they will relapse or engage in risky behavior, which only enhances the stigma around both mental illness and addiction, as well as treatment and treatment providers and the good that we're trying to do. So this requires advocacy. Overcoming these challenges requires constant advocacy to policymakers and funders around the length of stay, having the appropriate length of stay for individuals engaged in treatment services, and also the increasing cost of care. Another essential challenge that we face is how to expand and adapt to meet the growing community need. We discussed it previously in terms of, again, our substance use treatment legislative agenda. It's always top of mind for us. How are we as agencies going to help meet the growing need in the community? And what can we do to help expand and adapt our services and how we look to the need in the community? This, of course, primarily requires infrastructure funding. Capital for bricks and mortar is very challenging to come by for community-based organizations and nonprofits helping with the Medicaid and the uninsured and underinsured populations. We can't raise money like anybody else. So we have to get very creative with our policymakers and our funders to help draw down funding from various levels to help create enhanced capacity. And this takes a lot of time and effort. As with all things in government, nothing will happen overnight. And securing this funding means staying on top of mind, staying on top of it, but staying top of mind as a reliable partner to policymakers, to funders. A lot of these things, if you draw down funding and you have the ability to do so, it requires constant advocacy because it doesn't all happen at once. So you have to take what you can get, move it along in piecemeal, and just work with what you have. And this is especially true for special programs such as, again, adolescents and women with dependent children that require specialized setting and require the integration of such services as case management and primary care. These things require additional funding and advocacy. So what we know is that we have to stay top of mind for our policymakers and our funders in order to ensure that they know what it actually takes to treat an individual's addiction in terms of the appropriate length of stay and what it takes for a provider agency to meet the need in the community. But another key challenge that's faced by community-based organizations is sustainability and survival as provider agencies. It is true, we have to be known to be remembered. Otherwise, as agencies of behavioral health services, we risk closure without public knowledge and potentially without public support. Community-based providers reduce healthcare and criminal justice costs, as well as the burden on hospitals. And that has to remain the focus. We must be in connection with one another. That is how we collectively advocate, and that is how we advance our legislative agenda. But sustainability and survival as a provider agency comes down to a lot of factors, including reimbursement, workforce recruitment and retention, the impact of COVID-19, the Medicaid unwind, which we're looking at closely right now, and other issues that providers have to keep, provider agencies particularly, have to keep top of mind in order to stay sustainable, to stay in operation, providing services, employing individuals, but continuing to impact the community in a beneficial fashion. So again, understanding your audience, their awareness, and your approach is going to be key to addressing these challenges. And there are some things that you can do to help yourself be prepared and present to take on these challenges. First of all, identify your champions. Having key committee chairs or civic leaders that rally to your cause very much helps in advancing legislation. Write it down. If you have something you want read, document it. Be brief and succinct. Share your materials in advance and leave them behind. But you will find that there is no substitute to actually taking the time and effort to write down what it is you want communicated to folks of importance. And show up to the table. provide that written and oral testimony on the issues that matter to you, as well as the work that you're doing in the community. I've often heard it said, if there's not a chair for you at the table, bring a folding chair. So that's what we as behavioral health advocates really have to do every day, is bring our own folding chair to the table. You'll often find that that's very true in terms of how funding is spent and how treatment services are delivered. When policies and regulations get made around treatment, you will often find that treatment providers are the last that are invited to the table. So we have to invite ourselves, and we have to bring that folding chair. Additionally, you want to follow up. You want to be consistent and be ready to provide additional info when it is requested of you. Always, always, always express thanks. A follow-up email is fantastic, but you know what's even better? Writing an individual thank you note and putting it in the mail. There is nothing today quite like it. And taking that time to actually write down your gratitude and put it in the mail, that will go a long way, and individuals will remember that. So again, sending an email is really great. You always, always want to express thanks, but writing and posting a thank you note is even better. If you work for an agency or within an agency that provides behavioral health services, you should invite officials to your agency and give them a firsthand look of your services and the impact that you have. It's one of the most powerful things that you can do. And there are ways to easily accomplish this while protecting patient confidentiality. And lastly, you want to be a resource to your policymakers, to your funders, stakeholders, those in the community. Extend yourselves, extend your agency and your expertise as a constant resource to policymakers and those in the community. There is really no substitute for it. So how do you get started? If you're just getting started and you have a clean slate in terms of behavioral health advocacy and crafting your own legislative agenda, what can be helpful to you? Well, here are some tips that you can do today. And I'll also give you some things that you can do moving forward. So what can you do today? First, in your agency, identify a policy and advocacy lead. It might not have to be their title, but you want to make sure that someone in your agency has their pulse on the issues that matter to you. Keep a key contacts list. 100, 200 sounds like a good number of local, state, regional, international contacts, policymakers, funders, stakeholders, just folks that contribute to the good that your agency does and that you want to know about that good. You want to keep that list of their email addresses, phone numbers, and mailing lists. Send out newsletters, holiday cards, or annual publications. If you start a newsletter, that's a really great thing to get out there. You can capture succinct information that's out there and put it in one document for people to read. Send it out weekly, bi-weekly, monthly, whatever. Include agency or organizational updates, industry news, public policy, professional resources. Load it down. Because you can be a good resource for others just by way of paying attention and capturing that information for others. But also, if your agency wants to send out holiday cards or annual publications, that's a really great way to capture what your message is and what you're doing. If you have economic impact data that you can help present to the public, that is hugely beneficial, especially from a legislative standpoint. It might require independently bringing someone in to talk about your services and kind of give you an idea of what your economic impact is. But if you can present to your funders that this is how much they spend on you and this is how much you save the city, the state, that can be hugely effective in crafting legislation and policy. If you have issue briefs around your issues, craft those issue briefs and white papers around your specific needs and challenges. Again, be brief and succinct with your information, but be comprehensive, be substantive, leave room for questions. Make sure you identify who the contact is on that issue brief. And always include, if you're sending it to legislative committees, always include staff. The staff on those committees are some of the most genuine, knowledgeable, informed, helpful individuals in state government, and you will find that they are in it to be able to give you the answers that you need and help you get your bill crafted right and get it passed. Lastly, if you need to join an association, I would say form an association if there isn't one that you can join. But in Louisiana, we do have really robust associations for mental health, for substance use, for behavioral health. So there are associations out there on the levels of your funders, on state and federal and local levels. And you want to make sure that you are in connection, in association, and in collective advocacy with like providers and like provider agencies. And get on social media. It's never too late. It's never too late to learn a new medium. It's never too late to learn a new skill. And it's never too late to put out there for more people to see what the good work it is that you're doing. So whatever it is, Twitter, Instagram, Facebook, get on it. But those are some things that you can do today, just in terms of making sure that you have a strong advocacy point within your agency, keeping a contacts list, making sure that the information that you want to be disseminated is actually captured and put out there for the public, and making sure that you can be in collective advocacy with like providers. And lastly, some things that you can do moving forward. Not just today, but in the future and always. So first, you want to identify the conversations relevant to your work, and you want to be in the room. It's no substitute. No one can really speak for you, and no one can speak for the good that your agency is doing and the services that you provide. So it really is appropriate that you speak for yourself in these settings. Follow up on your asks. Again, make them, be clear, be brief, be succinct, follow up, and be consistent. You want to invite policymakers, funders, and stakeholders to your site. Do so regularly and look for opportunities to provide updates on the good work that you're doing. Literally create those opportunities. If you need letters of support from policymakers, request them. They'll give them to you. Getting letters of support is, I wouldn't say it's always 100% that you'll always get what you ask for, but you'll never get the letters of support that you don't ask for. So make sure if your agency is trying to expand, is trying to do something good, is trying to tap into grant funding, whatever the case may be, don't be shy in asking for those letters of support from your policymakers and your funders, because it shows that they are in support with you and of you and of the services that you provide. Again, send handwritten thank you notes and at every opportunity, whether you just had a run-in or a great conversation with somebody, whether they, spoke about something that really impacted you, whether they visited your site, whether they gave you money, whatever it is, you are really in a good position to be able to express your thanks by way of a handwritten note, and there is no substitute for it. And lastly, what you can do moving forward is miss no opportunity to be present, be seen, and be heard. If you just look for online or these meeting notices, if you look anywhere in terms of when the appropriate boards and commissions relevant to your work are meeting, you can find that there are opportunities to be present, to be heard, but also to submit advanced testimony. So these things, in terms of providing written and oral testimony, really, again, cannot be substituted. Following up, sending handwritten thank you notes, requesting letters of support, inviting policymakers and funders to your site, and missing no opportunity to be present, seen, or heard, really are some great strategies to hone a legislative agenda that you want to be successful. I'd like to close with a quote that was shared with me several years ago by a colleague about advocacy, particularly about behavioral health advocacy and community-based provider organizations. A lamp can only light another lamp when it continues to burn its own flame. That was told to me, and it was very impactful, because in advocacy, particularly behavioral health advocacy, providers often operate in silos. And we feel, especially when things are very challenging, when the need is intensifying in our communities, when we don't necessarily feel like we have adequate resources or a posture to take on these challenges, it can feel very dark. And it is important that as behavioral health advocates, that we continue to keep our lamps lit, because we provide that light. We help to light other lamps, but we also inspire others in advocacy to carry on their own torches, so to speak. So I appreciate the opportunity to speak with you all today about behavioral health advocacy, about substance use treatment providers, our legislative agenda, and some of the things that we have to look forward to in the next year and in the future. I'm always available for anyone that has any questions or would like to connect around these issues around behavioral health advocacy. And my email address is lgranier, it's LGRANIER at OHLINC.org. That's lgranier at OHLINC.org. Thank you very much.
On behalf of the Louisiana Mental Health Association, I want to sincerely thank you for joining us today for our 3rd annual Public Policy Summit. I also want to thank our speakers who graciously took time out of their busy schedules to present and share their passion for advocacy. It is through your advocacy that we can continue to make Louisiana a better place for those who have a behavioral health condition. In the words of Margaret Mead, never doubt that a small group of thoughtful, committed citizens can change the world. In fact, it is the only thing that ever has. All it takes is a small group of determined people to help bring change. We hope that you learned valuable information from each of our speakers and are able to use these tools in future events like our Behavioral Health Day on May 4th. After today's presentation, I will follow up with the Advocacy Toolkit and further information about our annual state conference, our new merchandise, and our Behavioral Health Day. So please be on the lookout. Thank you again, and go out there and make a difference. If you have any questions about today's presentation or our future events, please do not hesitate to email us. Have a great day and take care.